qina umuntu ophila entshonalanga gawulayo qina. Qina umuntu ophila nentshonalanga gawulayo qina. Siyabonga. Sizawuqala soon as uMary beshilo. Siya apologize ukuthi sibe kanti asikaqali ngoba basekhona abanye abazayo. But sizawuqala in the next 5 minutes. Igama lami ndinguAnele Yawa. I am the General Secretary of Treatment Action Campaign and the Chief Accounting Officer of Ritshidze. This is a community meeting yabahlali. So sizawulinda for 5 minutes and make sure that by at least 5:30 siyaqala. 25 past 5 minutes, 5:30 exactly siyaqala. So before siqale sizafaka ingoma. Ukhona okwazi ucula pha phakathi? Asikhokhele ngengoma. We will complete. Awe mama we mama we mama we mama we mama muthulu ngakhala. Hayibo. Mama we mama we mama we mama we mama muthulu ngakhala. Solenyembezi mama we thulu ngakhala. Yes socialism mama we thulu ngakhala. Solenyembezi yes socialism mama we amandla siyayazi wona lena ithi kodwa yini socialism treatment ezibhedlela zaba akona muntu namuntu ngakhohla makha yini socialism treatment ezibhedlele akona muntu ngathola khona makha ini socialism treatment ezibhedlele akona muntu ayesabo manto oyesabo manto oncewa ngoloma babefuna kusetyenzelwa ngapha oyesabuzwele oncewa ngoloma babefuna kusetyenzelwa ini socialism treatment ezibhedlele akona muntu ngathola khona ini socialism ma ezibhedlele zaba akona muntu ngathola khona oyesabo phahla oncowa ngoloma babefuna kusetyenze oyesabo phahla oncowa ngoloma fono kusetyenzelwa indi socialism ma treatment ezibhedlele akona muntu mandla I'm sure igazi lethu lishushu kancane manje ithi le ngoma maqabane iyabuza this song ukuba yintoni socialism if there is no treatment kwimitholampilo kawonke iphinde ithi uyesaba uJoe Phahla uncowa nkulu ngoba ufuna usetyenzelwa ngabantu mandibulise kwakhona amaqabane ndizichaze kwakhona abantu ngianele yawo General Secretary of Treatment Action Campaign and the Chief Accounting Officer of Ritshidze. I am with Lama comrades as I introduce amagama wabo and then we start the program.
Ngiyanibingelela nonke mina igama nguSimphiwe kaXaba ngi-project officer kaRitshidze ngiyabonga.
Sanibonani, igama lami nguSibusisiwe ngwakasibiya, ngu-district organizer wakaRitshidze, also a member of the Treatment Action Campaign. Thank you.
Sanibonani comrades, James Oladipo, researcher with Ritshidze on the Key Populations program.
Thank you. So, in the room, we sinamalunga omphakathi abasebenzisa imitholampilo kawonke. Ngaphakathi I am made to understand ukuthi bakhona abantu abasuka kwi-district office of health as well as abo facility manager. But as soon as amagama abo econfirmwa kum, I will acknowledge them officially as a program is unfolding. Also in the room, sinazo inkokheli ezisuka from NAPWA, Positive Women's Network, Sanarela, as well as Treatment Action Campaign from here in the district. Also, we have people who have joined us online from the National Department of Health, from PEPFAR, South Africa, from CDC, USAID, UNAIDS, and many others like your district support partners, but also sinawo amalungu omphakathi as well as amalungu of a sector of people living with HIV who are watching what is happening here from other areas around la Pietermaritzburg and KZN at large. Manthathel thuba ndithi namkelekile nonke. Kuyatshisa phandle. If nifuna ukhumula ibhatyi nizibeke esitulweni, feel free kusekhaya la. It's not personal, Kokeli. So, colleagues, bahlali, today sihlangana la uMgungundlovu sizokhipha ingxelo ngomsebenzi owenziwa yiRitshidze. iRitshidze is not a research institution. iRitshidze is a consortium umdibanisela wenhlangano ezi5 of people living with HIV in South Africa, which is NAPWA, Treatment Action Campaign, Sanarela, Positive Action Campaign, as well as Positive Women's Network, and all these organizations ziyahlala pha kuma AIDS Council at SANAC level, national, provincial level, district, and in local AIDS councils. Inhloso ke yeRitshidze as bengitshilo ukuthi is not to do research or study. iRitshidze inhlangano eyenziwa ngamatshanhliziyo and people living with HIV apho bahamba kwi-clinic ne-clinic more, especially as clinics that are supported by PEPFAR, to monitor the quality of HIV, TB services, as well as services that are meant for key populations. So that's the key populations most. Your LGBTQI, your sex workers, people who use drugs, MSM, you name them all. Because inhloso yethu is to make sure ukuthi everyone who lives with HIV, everyone who is a public healthcare user, mana esiya emtholampilo athole inkonzo zempilo ezisemgangathweni. Ngoba kaloku we've got a constitution in this country, and with constitution we have section 27 of the constitution that gives abantu, people who are citizens of South Africa, those who live and work in South Africa, a right to access quality healthcare services. Siyakhumbula ke maqabane kwiminyaka eminingi eyadlulayo in South Africa, people who are living with HIV were dying because there were no ARVs bingekho imishanguzo. During that time, we had to President uThabo Mbeki, no Minister uManto Tshabala Msimanga, who said, people who are living with HIV, they must eat beetroot and garlic, not ARVs, because ARVs are toxic. We had to President then uThabo Mbeki, who refused to provide antiretroviral treatment. And we will remember, in South Africa, more than 300,000 people died of HIV. We had to stand up and fight against our government. We had to take our government to court. We had to occupy all offices of our government. We had to take it to the streets. We had to be arrested. We had to be shot. But we are proud to say today, in South Africa, out of the 8 million plus people living with HIV, we've got up around 5 million people living with HIV who are on antiretroviral. And if it was not for Inchukumu, the organizations like TAC and others, today we were going to be counting 5-point-something million people who died of HIV. But because we were able to stand up and defend our constitutional rights, and in that process we saved lives. We won those battles, Gemakaban. And after winning those battles, There is no way after we won a battle and we step back and say, umzabalazo se achievile. Our duty is to make sure that each and every person who is living with HIV in South Africa is initiated on antiretroviral treatment so that we can save lives. Our duty is to make sure that each and every person who is on antiretroviral to adhere to a treatment, a viral load to be suppressed, and all what have you. It is our duty to make sure that everyone who is living with HIV, when they go to the clinic, they get quality services. You don't walk out of the clinic without getting your treatment. You don't walk out of the clinic without getting services that you are supposed to get. Whether you are a man, whether you are a woman, whether you are a sex worker, whether you belong to LGBTQIA, because this is our constitutional right. These are our rights. We've got a right to exist. We've got a right to life. So, Londo ke ngoku forced us ukuthi siye kwezi clinics that are funded by PEPFAR to monitor equality of services. Sikhulume nomphakathi sizwe ukuthi are they happy na nge-services abazitholayo, so that if they are not happy, we can go kubaphathi, starting from kwi-facility, kwi-district, kwi-province, up until to national, and say this and this and this and this must be done. More especially manje sikhuluma nje eNingizimu Afrika kukho new ART guidelines which gives more opportunities to people living with HIV. Manje sikhuluma nje kukho iprogram ekuthiwa yi-CCMDD program. Lena ibangela into ukuthi when you are stable on treatment bakukhiphe clinic bathi ambo collector i-treatment yakho outside nearer to home. These are some of the things that we fought for, and we are making by all means to monitor ukuthi yonke into yenzeka kakuhle, so that aba badikhendiweyo ungayi e-clicks xa ufike e-clicks kuthiwe ayikafiki treatment yakho. And then if ayikafiki treatment yakho and you want to adhere, you will be forced to leave clicks uye ku-clinic yakho uyofuna treatment. But also one of the things that we are pushing is what is in the policy, because the government now has approved a policy ethetha nge-multi-month dispensing of medication. Uye xa ustable ku-treatment yakho uyeke every month umane usiya emtholampilo walking 5 kilometers to and from. If you are stable, we are say iti policy either you are given a treatment 3 months to 6 months so that you don't end up going to the clinic every month. These are some of the things that we are monitoring. So, but also we are monitoring the standards and conditions of our clinics, including the attitude, be it good or bad, that we get in our health establishments, so that we can be able to advise aba ba in authority ukuthi bangenza kanjani ukuthi both the providers of healthcare services and the users babe happy. But on top of that, we know ukuthi communities esihlala kuzo, in some communities kunzima ukuthi sibe nama mobile clinic aya kumphakathi because of amaphara azibamba inkunzi besabe onesi, even ambulances azisakhona ungena kakuhle kumphakathi because basaburojo, and even kuma clinic ethu. That's what we were talking about even yesterday at Tekwini noma mumasondo. District director was at Tekwini ukuthi we need to reach out to the provincial police commissioner, to the district police commissioner, to make sure ukuthi siyasebenzisana kunye nabo in order ukuthi i-clinics zethu ne-services esizitholayo zibe kanti sizithola kwindlela esafe. So today we are having this meeting to give ingxelo. Bakhona abantu bomphakathi nabo abazilungisela ngengxelo ukuthi zinjani services abazitholayo. Bakhona abanye esizobazwa berekhodiwe. Sabe sikhuluma ngendaba ye-staff and waiting times, sikhulume ngendaba ye-ART collection, sikhulume ngendaba ye-ART continuity, sikhulume ngendaba ye-key population services, sikhulume ngendaba ye-index testing, sikhulume ngendaba ye-infrastructure and conditions of our clinics, and sigcine sikhulume ngendaba ye-infrastructure. Zawucela ke maqabane, apha phakathi kwethu sinaye usister Ngubane oyi-manager yase-Northdale Hospital, sibe naye ngu-ST, sibe naye u-SL Madlala oyi-facility manager yase-Mpopheni Clinic, sibe naye u-CM Dlamini oyi-facility manager, no-JT Vilakazi oyi-facility manager Songonzima Clinic. Siyanamkela nonke, sisonke apha. Ngela xesha lakudala sasisilwa for i-treatment. We used too much with iCOSATU. Isakhokhelwa ngaboZolinzima Vavi naboWillie Madisha. Sasinengoma pha sasicula ethi umhlali nenesi alliance. Umhlali nenesi alliance. Yeah, we used to sing those songs. And I hope ukuthi the spirit of today's meeting is gonna be in line with that, to say umphakathi ningesaba ukhuluma, because nesaba ukuthi xa ukhulumile next time to see clinic uzawuthi facility manager nangu lo bekhuluma asikhulumeni bantu bakuthi nabo manager singabajaja abahlala ukuthi manje ekhuluma uthi sizomthola eclinic, because at the end of the day we are all up sibonisane ukuthi senza kanjani ukuthi sifixe inkinga esinazo kwi-clinic zethu, in order ukuthi umphakathi xana une appointment yokuya clinic ungabi free when we go to clinics. And the only way to do so is only when we have like this, identify problems, season proposals as to say.
Today we were in King Tetwayo, yesterday in eThekwini, and today in uMgungundlovu. We will be deep diving into both the progress and challenges across the three districts, and hear directly from people living with HIV, people who use drugs, sex workers, LGBTQIA plus community members, and other healthcare users as to the real experience using clinics in the district. Today we are in uMgungundlovu, where we monitor 14 facilities. Data are collected through observations as well as interviews with healthcare users, which includes public healthcare users, people living with HIV and key population, and also with healthcare providers, which are facility managers and pharmacists. Data in this report were collected between July and August 2023. Interviews took place with 14 facility managers. Observations took place at 14 facilities. Interviews took place with 778 public healthcare users, which 49% of them identified as people living with HIV and 18% identified as young people under the age of 25. Additional data was collected between July and September 2022 amongst community of key populations. Interviews took place with 47 gay, bisexual, and other men who have sex with men, 167 people who use drugs, 94 sex workers, and 39 trans people. Our first group of issues are on staffing and waiting times. Improving the state of health services provided at our clinics so that all people living with HIV and key populations can access friendly, welcoming, and quality services depends mainly on having enough qualified and committed staff in place. Yet, this year, only 39% of public healthcare users interviewed reported that there are always enough staff at the facility. We note that this has improved since last year, where only 16% of people said there were always enough staff. The best performing sites, Taylor Alt's Clinic, and the worst performing sites are outlined in the table shown on the screen. From the perspective of facility staff as well, 36% of facilities monitored reported that there were enough clinical and non-clinical staff to meet demand. While this is up from 20% last year, there is still a way to go to fill the human resource gap, as 64% of facilities remain with too few staff to meet demand. Of facilities reporting shortages, 11% of facility managers blamed there not being enough open positions on staff shortages, while 22% blamed staff shortages on one or more unfilled vacancies. According to facility managers, the most commonly understaffed cadres were professional nurses and data capturers. There were 23 vacancies reported in this reporting period among professional nurses, enrolled nurses, and enrolled nurses assistants. 62% of facility managers we spoke to specifically wanted additional human resources for health support from the PEPFAR District Support Partner Health Systems Trust. However, PEPFAR's funding for critical HR posts has only reduced in recent years. Average waiting times has reduced by just over 30 minutes in the last year in facilities monitored in uMgungundlovu, down from 3 hours 10 minutes to an average of 2 hours 37 minutes in the facility. This includes time before the facility opens. And waiting times after the facility open has reduced from 2 hours 59 minutes last year to an average of 2 hours 34 minutes waiting after the facility opens this year. 5 facilities monitored had waiting times over 3 hours as outlined in the table. 31% of public healthcare users interviewed in the district still think the waiting times at the facilities are long, and this is a major source of dissatisfaction. There has been a major improvement since last year when 67% of public healthcare users thought the waiting times were long. 56% of public healthcare users blamed long waiting times on staff shortages and 28% on staff working slowly. While 95% of public healthcare users were aware of clinic appointment system, only 11% reports getting both a date and a time, and 87% report just getting a date. This means when people arrive early at the facility, they arrive in clusters in order to get seen, and the clinic becomes early by the afternoon. Appointments could be spaced out throughout the day to ease congestion. Filing systems were observed to be in good condition in 86% of sites monitored. This is down from 100% last year, mostly due to filing rooms being too small to maintain and files being stored where patients can access them. 39% of public healthcare users blamed long waiting times on messy and disorganized filing system. Messy and disorganized filing systems increase delays and increase the burden on already overstretched healthcare workers. The average earliest time has improved from 5:20 a.m. last year to 5:45 a.m. this year. However, people still begin queuing early in the morning in an attempt to get seen more quickly. 64% of facilities monitored still have an average arrival time before 6 a.m. Of 290 people who arrived before the facility opened, only 4% reported feeling unsafe or very unsafe while waiting for the facility to be opened. This is down from 32% last year. While a circular was issued in May 2019 by the National Department of Health, calling on facilities to open by 5 a.m. on weekdays, only 2 facilities opened by 6 a.m. and the rest by 7 a.m. Commonly, facility managers tell us that they are unable to extend opening hours due to insufficient staffing to cover this time. Yet, 21% of public healthcare users do not think the facilities are open for long enough, and 62% think that extended hours would improve access to services. We now move to recorded stories.
Into engiyibona eAzaria clinic lethu ngithatha khona treatment ama-ARV. Eclinic siyahlala, but kodwa kusuyana eclinic asinaso. Makukhona unesi oyedwa ongekho, yonke into iyama. Uyawuhlala msuthu abawasathe ngesikhathi, bawise ngesikhathi. Laba abathatha amafayili ethu bawalahla. Nanokuthi lona omunye mase living lona omunye hayi wenza kancane shame yakho nje ifoni yakhe nje amafayile eyinqwaba lapha phambi kwakhe kufanele awabhalisa angawabhalisi wena umile kubuka yena ke kuthena usachofa ifoni tshela ukuthi uzosebenza bafike ekseni nje basebenze umuntu angayichofa ifoni phambi kwakho ngoba ngesikhathi uyichofa ifoni phambi kwakho awusayezwa lento ayishoyo noma
bethi laba bade besebenza ebusuku bethi angilokhuze angilinde laba bazofika ebusuku ekseni bezonginikeza ifile ngoJuly lo nyaka 2023 ngahamba ekseni la ngiyolanda amaphilisi ama-ARVs hayi ke ngahlala ke bangibhalela izini uma ngifika mase befika laba bafika ekseni sengiyabanikeza senginikeza phuni enginikeze ifile ngithi ngoba bese ngiyeke ukuthi ke sengizoyeka ukuthi ngiwathatha amaphilisi ngoba phela ifile yami bengayitholi futhi lo osikhiphelayo akakwazi ukuthi engikhiphele kwabanye ngoba baningi benza njalo ngoba nobaba kwami wakwenza lokho wangakwazi ukuthi emkhiphele ifile wazi waphinda futhi wabuye ngakwenzile lokho ade yokwenza wabavuka ngakusasa futhi angizange ngiye complain kodwa nje ngendlela nje abantu bathi abaningi bathi nabo sebeyile khona ku reporter kwathulakala kanjani ngoba ubesayiqhubeka lento akayenzayo mina kungiphatha kabuhlungu impela ngoba phela njengisuke ngivukile ngolanda into zami amaphilisi ami ngendlela mangasawatholi okunye lokho kuzokuthufala lapha eclinic kusho ukuthi ngidifodile mina ngisawadla amaphilisi
kushuthi mina ngihlala kaPata eclinic yaKaPata ngelinye la ngiumuntu ophila negciwane leHIV na nevithamini cancer bengade ngine cancer so ngumuntu ohamba hambe ngibe nama data dokotela ePata ngahamba ngaya eclinic kuyidate yami yokubona udokotela ngafika ekseni mangifika eclinic ngahlala eclinic lokuthiwa ifile yami ayitholakali kuze kube intambama mhlambe ikhasi kwako 3:30 sengilambile ngize la ekhaya ngizodla kancane kwangumuntu oseduzane nemtholampilo ngibuyele futhi khona ngibuza ifile yami ayikatholakali nithiwe cha athi ngihambeke ngiyongena ku sister ngimtshela ukuthi wangene lapha ku sister ngifile yami ayitholakali bangenzela iphepha ngingene ku sister sister ngiyakwazi ukunikeza amaphilisi lento yenzeke ngoJuly kuona lo nyaka athi ngiyakwazi ukunikeza amaphilisi ngoba ifile yami ayitholakali akukho la izobona khona ukuthi ngidla nhlobo namaphilisi ngimncenga usister ngithi awu sister bandla ngiyakucela ngoba amaphilisi enhlungu angisenawo ubone ngiphila ngawo mangabe ngekho angilali inhlungu nodokotela uyazi ingakho ade kuyidate yami namhlanje athi nje ngeke azakwazi hayi ngiphume sengiphatheke kabi sengiphethwe nayisiyezi sengiyakhala nje yahlahla kusavuma ukukhuluma ngifike like ekhaya ngifika usisi wami babuza ukwenze njani ngibachazela ukuthi kade ngihlele eclinic manje abasafuna ukunginikeza amaphilisi bathi ifile yami ayikho usisi wami athi asihambise eclinic angithathe usisi wami omdala kunami angise eclinic athi udokotela ungenile kena ngithi cha banqabelile athi uyawazi umnyango kadokotela ngithi ngiyawazi asivele singene udokotela ngqongqoze singadress ngene athi ngene uchazela udokotela isitori sakho ngingene athi nodokotela phatheka bathi phawa banginikeza ngalutho ngithi mina cha into ebengizoyicelela nani sengicela amaphilisi enhlungu ngoba ngeke ngize ngilale mangabe ngingenawo ungipheke nawe HIV ngiphume usisi wami sangilindile athi bona kuphela amaphilisi owatholile lawo ngithi mina athi hawa HIV na ngithi abanginikanga athi asamse office lamphathi yafika athi ngena umphathi uchazela isitori sakho ngiye eclinic umphathi ngifike ngichazela umphathi nginenkinga kanje ngifike ekseni ifile yami ayitholakala kuze kube manje abafuna ukunikeza amaphilisi sengize ngayingenela kudokotela benginqabile udokotela unginikela amaphilisi kuphela lamaphilisi awasangisizi inhlungu yaqhubeka ngizizwe so ngiphila ngetramadol bengicela bandla mphathi unginike tramadol noma unginike noma amaphilisi ami HIV umphathi anginika ngibhele netramadol asho nomphathi ukuthi lento yala eclinic yokulahla amafile emphatha ngempela ngoba egcineni kugcina kube inkinga yakhe wanginikeza amaphilisi ami umphathi HIV wanginikeza itramadol wanginikeza nepain block ngabuya kanjalo ngaphatheka kabi kakhulu ngoba nje ngase ngiyiwiki sengiphethwe nayisiyezi into engangicabanga nje ukuthi ngizolala kanjani ebusuku ngoba kwayibona lawa HIV ngase ngingasenawo kwangiphatha kabuhlungu impela nje lokho ngiphatheka kahle clinic njengoba ngangifike khona ngo7 ngazi ngahamba kwakuyoshawa 4 isuke eclinic sebengitshela lokho sebezovala
Ungatholanga
ngingatholile lutho ngahlala ngazi ngabuya ngazodla ekhaya ngazi ngaphindela futhi iyavala ivule ekseni vala intambama ngama weekend ayivule yeba base belungisela ukuhamba kwasuyinto ephuthumayo nje ngoba khona futhi sekusiswamo sengiphusha ngoba bayayazi inkinga yami ukuthi inhlungu zibankulu kakhulu mangabe ngayithola ngitramadol ngivictim nje cancer ngibe ne-cancer yahanga ngayidla chemo yahamba yoshiswa ngihamba ama-appointment adokotela ukuthi ngilonge i-check i-cancer yangiqala ngo-2000 ngayithola ngo-2021 ukuthi ngine-cancer i-cancer yesibeletho ngithola amaphilisi bengithola amaphilisi la 3 months mangabe nginikezwa isikhathi kango-6 months ngibuye ngivuselele ngihambe ngiyovuselela eclinic bese bafaka ndawonye ikhadbothi ngithi ngifika bangisendela messages phaselaami sefikile bese kubila ama-dates kadokotela ke ngiyepata or e-address bese lokho kuba isikhathi esingango-6 months bese kuyaphoqeleka ukuthi ubuye eclinic nebhasi uyovuselela futhi upin card wakho ukuthi uphinde ubuyele kwi-container la ngenhla komgaqo yebo bayasichazela futhi bayasichazela
Anonymous lokhulumayo ngihlala eAzalia A1 ngisebenzisa iAzalia Clinic ngo-2021 ngalahlekelwa ifile yami ngithi ngiyothatha amagazi ngangayifica kwadlula 3 months kufanele ngibuye ngawo banginika iphepha bangibhalela ephepheni so ibhanqane nabantu kade befanele beyothreswa ithatheke ngephutha okay waxolisa ke umuntu oyithathile okay it's fine saqhubeka sasebenza into eyakenzeka ngalelo langa ngaphatheka kabi ngoba kunalomkhubo ukuthi amafile ayadayiswa ahamba abantu beyohola ngawo so ngaphatheka kabi ngokuqamba amanga nanokuthi eclinic eAzalia ufika ngo8 uthothi babamba meeting kanti thina sazothi u8 ona isikhathi sokuqala somsebenzi okwesibili bebamba meeting sihleli thina emabhentshini ngoba bathi bona kufikana ekseni istaff sakhona siyashoda ngoba bancane abantu abasebenza abantu okuedela istaff abesingajabula ukwandisela iclinic lithi kuvuleka lincane iclinic laseAzalia singabe singajabula
So into eyenzakalayo ukuthi abantu
on Saturdays.
So ngingene umntanami ngokubona kwami nganginokuthi uyaqhumisa but kwahamba wasekuwesi because wephalaza
My child was just teething, but as the day went along,
mengifika lapha ngifike okay there was a queue understand but ngokubona kwami nganginokuthi ngoba ingane incane futhi engakahlanganisi no 2 years bazoyithatha nayo bayifake kuma emergency room.
there was a queue when I got there, but according to what I had expected, considering the fact that my child was still very young
Recording in progress.
and was showing signs of not feeling well, I had expected them to.
And nakhona while I was waiting iqueue ihamba kancane bayazikhulumela baphume baye lunch baphinde babuye.
I waited for about 2 to 3 hours, and during this waiting period, they were taking lunch breaks. The nurses were taking lunch breaks, working very slowly, and
It happened
at this point, I asked them how this was possible because I had explained upon my arrival the situation that the child was, that we deserve. But I was hurt particularly on that day from that experience with the way the facility staff dealt with my issue.
Anonymous, Mayo, ngidla treatment yesifo sokuwa.
I take treatment for epilepsy.
Ukuyidla yami treatment bezingekho inkinga sonke lesikhathi ngaqala nje ngimncane ngiyingane right. Sekusuka eclinic banguvela la kuthiwa khona usuthatha iparcel.
I've never had problems with collecting my treatment. I've never had problems with collecting my treatment from when I was born up until recently when the facility decanted me to a external pick-up point closer to me.
Okay, maphaseli kuba right ngathatha kungekho futhi inkinga ngiwathola nje wonke amaphilisi ami right. Uthe kusuka lapho mengithi ngaya emaphaseleni iphasela lami ngangalithola phinde ngaya kahle ukuthi 2 days ngaya futhi ngangalithola.
At first, there were no problems with the external pick-up point, but eventually I went and couldn't access my treatment, so I went again 2 days later, still couldn't get my treatment.
Hayi ngasukuza-ke kathiwaya ngize ngaphakathi ngikhiphe ifayili-ke ngizosizakala ngaphakathi.
When I asked what was happening, I was advised to go inside the facility to be assisted.
Ngaya ngaphakathi bengifika kokuqala-ke ngawathola amaphilisi ami, bengiwathola nje ngawathola kukhona amanye iphakethe angabi khona.
When I went back into the facility, my treatment was not complete.
Kukhona ngakhona ngahamba ngaye ekhaya mase ngibuyela futhi sekolanda phinde futhi khona treatment engekho. Mangabe ingekho le treatment ngibuze ukuthi hawu kwathiwa akudiliviwe ilwayiko ngibuza ukuthi kanjani ngoba ephaseleni bekuba right konke mase ngilandana ngaphakathi indaba kube khona shodayo.
On 2 occasions, when my treatment was incomplete, I asked why was it that my treatment was incomplete, because at the external pick-up point, I would always get my treatment as it was supposed to be, but inside the facility, my treatment was short. The response that I got was that at the facility, they've never, or it was for a long time since they've had the delivery from the treatment that I specifically needed.
Decide ukuthi ngabo March ngangabe ngisaya ekliniki ngangabe ngisayilanda treatment yami.
I stopped going to the clinic since March and have not been collecting my treatment since.
Mina istory sami kanje ngilanda ama-ARVs empilo enhle clinic.
I collect my ARVs from Empilwentle Clinic.
So ngifake ibhoko because ngilimala.
I wear glasses because I had an injury on my eye.
Into engidinayo ukuthi njalo mengifake izolanda treatment bahlale bebuza ukuthi yini ngigqokile.
What irritates me is that every time when I go to collect my treatment, they ask me why I'm wearing sunglasses.
Iyo lento yenza ukuthi nje ngienda because nani until last week bekumele ngigabe ngiwalanda ngiyocela i-transfer because kude empilo enhle. Ngancane ukuya ngoba manje iwedi better.
So last week I was supposed to collect my referral letter because Empilwentle is far away from me, so I wanted a referral to a facility closer to me, but I couldn't go to the facility because it wasn't sunny, so they were going to ask why I was wearing sunglasses when it's not sunny, hence I didn't go.
So we manje ngakayilandi ke transfer. Ngenxa yalokho ukuthi bakhuluma angazi bahlangana because kumele banginte engiyidingayo baphume kumina.
I really don't understand why they feel the need to comment on my physical appearance, because they should just give me my treatment and I will be excused, exit the facility.
Nenye into abayenzayo ukuthi mangabe sipasisa amagazi egcineni abasitshela ama-results athini babe masa right kanti sadinga ukwazi ukuthi ama-viral load nanani kwethu kuhamba kanjani.
Another thing that they do is that they do take routine viral load tests, but they don't explain our results to us. They just say that you're doing well, and we do need to actually understand what is happening with our viral load versus our CD4 count.
Siyabonga. We will go to recommendations. But before we go to recommendations, I have to acknowledge Councillor Thulani Matalane no Omtsalane no Sisi Cindy Mangoni. Before we go to recommendations, Councillor is the council and honorable, and also we member yet District 8 Council. But ke ufike late, so we thought ukuthi uzawusamkela. But again, zamnika nje 2 minutes asibingelele uCouncillor, and then I shoot straight to recommendations.
Thanks very much, Program Director. Indeed, my name is Thulani Mtalane, the Ward Councillor. Apology for coming a little bit late. Today, we have run some infrastructure projects, which deliver imgaqo ewadini Therefore, we had to ensure that the process runs smooth and then we come here. But nevertheless, I'm happy to be here. I'm also reminded of my previous life where I was a community activist working for an NGO. The work that you are doing here is the work that is familiar to us. In fact, playing oversight over the state health system is the work that is really, really needed. And the community is suffering because of the collapsing state of the health system. And we believe the intervention that you are making emphakathini naku system uqobolwayo will change impilo zabantu. We are just here nathi ukuthi sibe ingxenye yomcimbi eniwenzile nokulalela izimo enikhuluma ngazo. Siyabonga kakhulu. Have a blessed day.
Thank you. Before siye kuma recommendations, there are kunezinto endifuna uzifunda la. All information concerning a user, including information relating to his or her health status, treatment, or stay in health establishment, is confidential. 16 talks about access to healthcare records by healthcare provider. A healthcare provider may examine a user's health record for purposes of treatment with authorization of the user, study, teaching, or research with the authorization of the user, head of the health establishment concerned, and the relevant on the recorded videos and la engine. One, people are talking about missing files. When a file yam anele yawo is missing, it therefore means ilahleka kunye ne medical record yam isigulo sam sonke asaziwe. By the next time I go to the facility, I might be given a wrong treatment, or the facility might not know my health record. But also, we know umphakathi uyayazi ukuthi thina we don't go to the facility or we don't go home with our files siyena zwendlini sishiya kwi facility. And then if my file is missing inside the facility, ayonkinga yami leyo, inkinga ye facility. But we know in some facilities ukuthi bakhona abantu abazintshontshayo i-medical files of the patients bayozidayisa ngaphandle to other people in order for those people to apply for a SASSA grant using my medical record, and they impose them as abantu abagulayo. That's why most of the times ama users of services, when they go to clinics, file yakho ilahlekile, sometimes it has been sold out because there is no way a file of a person can get missing in a health establishment, which is a problem because many people are being turned away from the facilities if files zabo azekuzawuthunesi, we do not know your treatment, go back home, uyothatha icontainer ye treatment yakho. And other people are waking up as early as 4 a.m. to queue in those clinics, and they travel long distances to and from the clinic. Then just imagine you woke up as early as 4 a.m. At 12 o'clock, you are told to go and collect a container. You have to walk another 5 kilometers. By the time you get home, a clinic value. And on that particular day, you didn't get your treatment. I think this needs to be addressed because the National Department of Health told us that all people who are on ART are registered under utier.net, where our information is. Then if you are registered under tier.net, how does it happen when my file is missing? Or when I relocate, you tell me about the transfer letter instead of punching my information from the computer and then you get everything. I am banking with ABSA. I can withdraw my money at any ABSA in the country. We are citizens of South Africa. You can go to any office of Home Affairs in South Africa. If you stay in Eastern Cape and you happen to be in KZN and you've got an issue with your ID or passport, when you go there at Home Affairs, they will never turn you back and say, come with a referral letter. But when it comes to a department, we as the users, we are subjected to this. And one does not understand ukuthi yenzeka kanjani. And also this thing, shortage of human resource, it is a problem which is caused by the system and those who hold power. But inkinga ye shortage of human resource isibeka kwi situation as the country where a budget ye health does not go to purchase health services and goods. Huge, even here in KZ and even in Eastern Cape, Limpopo, all over. Huge amount of that budget goes to pay for medical legal claims because of negligence. When there is a shortage of human resource, staff becomes overburdened and overwhelmed, and then in that process, incidents of negligence do happen. And then people decide to sue the state. And you realize that the money that the state is paying for as medical legal claims is too much. And if the state was able to hire more healthcare workers, we are 100% sure that there might be a decline on cases of negligence and all what have you. Then lastly, in South Africa, I'm talking about the staff attitude. In South Africa, as I'm talking, the National Department of Health yasitshela ukuthi kuna 100 facilities ezingenzi kahle on the second 95 and the third 95, retention to care and adherence. But abantu abaninzi who are on ARV treatment abasayi emtholampilo baya defaulta ku treatment yabo. But nobody cares to know why people are defaulting. Many people living with HIV and other public health care users, including the LGBTQIA community, when they get into our clinics, they feel undermined, they feel ill-treated because they are shouted. Their status is disclosed without their consent. Omunye umuntu, when you go to a clinic for health services, instead of getting health services, some of the nurses, they start preaching a gospel. To be a gay is ungodly, or to do a termination of pregnancy is ungodly. You won't go to heaven. We are not going to health establishments to seek ukushunya yezo. We are going there to access services. If someone who is gay is going to a facility and ask for a lubricant, UNES does not have a right to ask you, uzawuzenzani. If you present yourself in a clinic with any illness, a nurse does not have a right ukuthi abize umngane wakhe wozobona lo bhuti unentshebe kodwa uthi ungumama. That is a violation of the rights of the patients. That is a violation of the constitutional right of the citizens of the country. That is the violation of the Patients' Rights Charter. And as the people of South Africa, we've got a constitution and the act. And I'm asking myself, what will happen if all citizens of South Africa were to know their rights as enshrined here? And UNES are disclose their status, and then you go and sue them because it is here. No healthcare worker has a right to disclose my status without my consent. In some clinics, that is involuntary disclosure. And as the result of that, if we are to do the analysis, a majority of the people living with HIV, more especially in townships, those who are stable with treatment, they do not take a treatment coma clinics where they stay because of stigma, discrimination, and involuntary disclosure. They decide to take a treatment quick clinics that are far from where they stay because la community does not know them. Then, when you are supposed to come on your next appointment, because treatment will take a day, agnamali transport on that particular day, and we told her the following day. The following day, when you go to the clinic, your appointment was yesterday. Whether you arrive early, today, today. As if on they don't miss appointments somewhere when they are invited or when they are supposed to do something. which is a problem because we are black people, we were colonized, we were oppressed, and because of that, not all of us we are at the same level in terms of ukufunda, in terms of affordability. And for us to go to the health establishment, we are not going there to ask for a favor. It is our constitutional right. It is my right to go to a clinic. And when I go to a clinic, no nurse can deny me what is my right. I have a right to stand up and fight for my rights. So I'm trying to say, the people of South Africa, their rights at times are violated in our clinics. Where abonnés, bias disclosure, bias shouter, they do all these things. And as a result of that, some other people decide just to disengage from care and they die in silence. And that's not what we want. We want to save lives. That's why we have meetings like this, so that sibe no khona ubonisana, so that the department nayo ibe no khona uhlala phansi kunye nabonesi. Not all nurses are the same. There are those rotten potatoes within the system. How does the department make sure ukuthi kwi facility umphathi uhlala phansi kunye ne staff sakhe athi this and this and this and this is not right? Even when you check isikhathi onesi bethu abasithathayo for itiye and lunch is more than what the government pays for them, because some they take 2 hours lunch and they are not supposed to do that. What is that called? Is to steal from the public purse, because some all of them are hired to work 8 hours, but some can work even 4 hours, and yet they want to be paid the full salary. So these are the problems that we are confronted with as the people of South Africa. I am going to read the recommendations, Makaban. The KwaZulu-Natal Department of Health should produce an annual report on the number of healthcare workers per cadre employed in each district. Include the number of people and size of areas covered by these healthcare workers, year-on-year comparisons from at least 2021, the vacancies and the cost of these posts to the government. Fill all vacancies in 2023-2024 financial year. The Department of Health should extend facility opening times as per the 2019 National Department of Health Circular. Utilize appointment days and times to ease congestion. Ensure filing systems are maintained in an organized manner to reduce lost files. Open clinic grounds by 5 a.m. so that people can wait safely in the morning. Ensure files are not required for facility pickup points. People living with HIV go directly to the pickup point to collect their ARV refill. Get more people living with HIV into external pickup points to reduce congestion in our health establishments. PEPFAR should support in filling all vacancies at PEPFAR Operation Putuma Support Facility in the short term. Provide additional staffing for all PEPFAR supported sites to extend opening hours from 5 a.m. to 7 p.m. on weekdays. Fund adequate numbers of adherence club facilitators to allow for the restart of adherence clubs. Health Systems Trust should immediately do an assessment at all PEPFAR Operation Putuma support sites with waiting time over 3 hours and develop a specific plan for each facility that will bring the waiting time below 2 hours. Support the facility to organize and maintain an organized filing system. Ensure files are not required for facility pickup points. People living with HIV must go directly to the pickup point to collect their ART refill. Get more people living with HIV into external pickup points to reduce congestion in our health establishments. We're going to the next issue now, but before we go there, we don't take pictures inside. As we were advised, if we want to follow this, it's going to be on YouTube. Everything that you want to see, you will see on YouTube. So, because when we take pictures, we disturb them. Thank you.
The next group of issues are on ARV collection. The revised 2023 National Adherence Guidelines note that time constraints are challenges to many people living with HIV. They go on to say that efforts should be made to support people living with HIV with suppressed viral load to receive extended ARV refills or be enrolled into a repeat prescriptions collection strategy. Implementing this is vital to supporting improved long-term adherence. Yet, Ritshidze data reveals only 38% of PHIV interviewed reports getting 3 to 6 months ARVs refills in this year in uMgungundlovu. This is a marginal improvement compared to 39% getting a 3 to 6 months refill last year, and it is well below 71% in Mpumalanga, the best performing province monitored by Ritshidze, and far below the 80% of people living with HIV in 21 other PEPFAR supporting countries reported to get 3 to 6 months ARVs refill in 2021. Of people living with HIV interviewed by Ritshidze, 36% collected standard medicine dispensing, with 45% collecting at facility pickup point and only 15% using external pickup point. Of people interviewed, 17% more are using pickup points compared to last year. Further, 69% of people living with HIV interviewed say that they would like to collect ARVs closer to their homes if they were possible. There needs to be enough pickup points to decant people into special linked to pre-urban and rural clinics. A diversity of external pickup points providers is needed beyond private pharmacy networks largely only available in urban areas. To services and rural areas, small CPDs and early childhood development centers to be considered. In terms of adherence clubs, these options have devastated since the onset of COVID-19. Importantly, in order to be effective, repeat prescriptions collection strategies should make ARVs collection quicker, easier and more satisfactory for people living with HIV. Yet, it is too often not happening. 46% of facilities monitored said that people using facility pickup points must collect files, take vitals, and see clinicians before getting their parcels. And 63% of people living with HIV also said that is in the case, adding to delays at the facility. Once enrolled, people should be made to keep people continually active. Positively, near everyone interviewed using the pickup points were satisfied or very satisfied. Reassessments should take place at each clinical consultations to understand if people living with HIV remain satisfied using their pickup points or clubs, and if their errands pickers should be offered other options. Now we are moving to recorded stories.
Ngimhlalo waseWilo, ngisebenza iklinikhi yaseWilo. Shuthi 2 weeks back ngibe nenkinga ukuthi benginendlela nge-daytime ukuthi ngilanda i-treatment ngidla ama-ARVs nganenkinga so ngathumela ingane ingane kushuthi yangawathola ngokuthi ayingekho kwi-mobile bese sengiyake ngakusasa ngafika sebawakhiphile bashiya eklinikhi. Okay, bathi ngihambe ngeklinikhi nakhona ngafike ngahlala nje iside isikhathi bengakanginaki kwathiwa nje ngifike ngijoyina i-queue ngajoyina i-queue mhlawumbe waphela u2 hours ngijoyinile i-queue ngilokhu ngihlehla ne-queue nokuthi nje abazange baze bangiphathe kahle bangibuza ukuthi bona fanele ukuthi basukume benze umsebenzi wangayizolo ngakusasa ngokuthi kade ngingadlulile phela isikhathi eside nginami ngishaya uvalo ngoba ngibona amaphilisi aseyangiphelele so ngavukayo ngakusasa ngahamba ngawabheka nje bangihlalisa u-half day bengakanginikeza amaphilisi ami. I-mobile delivela ngokuthi kuphuma imoto esuka iphethe wona amakliniki amaphilisi of which nalokho kusuke kuseyingozi ayikho indawo kuyiyona ekubekwa khona amaphilisi. Nakhona ku-mobile uyahlala ngoba siyafika sihlale nabogogo uyaphela mhlawumbe i-hour noma 2 hours ulindile bengakafiki ukuthi nje kuphela siyayihlupha ngokuthi sisuke sifuna i-treatment yethu noma ungakhathala uhlale lapho ushiswe ilanga kwezinye indawo kube ngaphansi kwesihlahla kwesinye isikhathi semzini omuntu kwesinye isikhathi isehholo lomphakathi basitshela ukuthi basuke benzela ukuthi basondezele amaphilisi ethu eduze singahambi ibanga elide kona kuyibanga elide ukuya ekliniki special for abantu abadala. Kokuqala nje uma benga-improve ukuthi isikhathi esisilindayo singabi sikhulu kodwa-ke njengoba sebesinikeza uMedipost
ngithi ngizothatha amagazi ngifike ekuseni ngo-5 alright vele iklinikhi ivula u-7 sifika nje ekuseni size sihambe ngabo-4 ntambama ngaloyo 4 sisuke sihamba ngawo nakhona futhi abakuphenduli kahle kuthiwe nje ufika ngalesikhathi okubona kushuthi isona sikhathi asuke sebesibona ukuthi okushuthi ufike ngaso kade ufikile ekuseni nokunye futhi amaphilisi sekuze inyanga yesibili le amaphilisi ngawatholi ngodate yamaphilisi kodwa idate isuke bona beyibhale bona ekhadini lokuthi ubuya nini for treatment amaphilisi ama-HIV mengabe ngifika ngithi ngizothatha amaphilisi ngifike kuthiwa iphaseli lami alikho nakhona futhi ngisuke sengihlalile kulayini ngalinda mase ngingena ngaphakathi kuthiwe amaphilisi awekho so angibuye ngaleyo date uma ngibuya futhi ngaleyo date kuthiwa amaphilisi futhi nakhona awekho inkinga bathi ayikho kubona inkinga iphambili. Into eyenzakalayo sesize sazakhela igroup kuya group of 3 abantu sesibolekana nabo ngamaphilisi because nabo engazi usibaba nenkinga ifanayo neyami so sengiyaphuma ngihamba ngocela mhlambe ngicele komunye lokuqala amaphilisi 5 days ngolandelayo wesibili ngiphinda amaphilisi 5 days mase buya futhi amaphilisi kushuthi mina afana ukuthi awasaphelele ngoba sekufanele ngikhokhele laba engithathe kubona futhi amaphilisi and futhi bakhuluma kabuhlungu kwaye ukuthi bakhuluma kahle mhlambe bachazisele nje nawe njengomuntu ukuthi mhlambe isizathu kube u1 no2 no3 bekuyiphasika 2023 April 2023 sasibuya ephasikeni ngine date yokulanda amaphilisi ngaya kwathiwa iphasela yami ayikho so ngihlalile during lapho uApril ngiphila ngako ukuboleka kanjalo kwazi kwa May ngawathola kwaphindeka futhi ngoJuly ngaze ngawathola manje ngoAugust so ngiyasaba ngazi mengiphindela ekupheleni kaAugust ukuthi mhlawumbe ngizobhekana nenkinga efanayo yini because kusho ukuthi sekudlulisa inyanga bengicela mhlawumbe benze njani kunikezwe onompilo siwa at least siwa collect konompilo because iclinic engazi ukuthi ithatha ngenye indlela iyalekha lapha nje nalapha
mina ngihlala eWillowfontein kaKhuzwayo ngisebenzisa eWillowfontein clinic ngithatha amaphilisi ye-HIV so ngika chronic into eyenzeka ukuthi ngafike ngaya kufanele ngovuselele indaba yaMedipost so kwaba nokuthi ngafika bathi bangivuselelile mase sengifanele ngiyolanda ngedate yami kwangiphoqa ukuthi ngihlale usuku lonke bethi abawatholi sengathi mina wrong ngibangawathola bakhola ukuthi ngivuselelile in ngazi ngakumphathi even naye wahamba eside isikhathi ngazi ngawumlande ofisini ukubuza ukuthi ngenze njani mina because mina ngivuselelile nawo ama-dates ukuthi sengilandani nanini leso sikhathi esikalwayo 6 months sokalwayo kuyikhathi uphinde uyovuselela ukuthi lekuyikhathi ngovuselela namhlanje hayi namhlanje bekhamba kahle shem bebesebenza nje ngicathi kodwa futhi nalokho kuphoqa ukuthi enkade kunesiphithiphithi sokuthi abasebenzi ngicathi nje ade besebenza ngoba kube naleyo nkinga awulindi ngaMedipost ufike ungene uwathathe uphume uhambe ukusayina kuphela into ofike uyenze bakunika amaphilisi kube kuphela kuyashesha khona kunoqueue eclinic.
Sanbon,
HIV positive. Ngilanda amaphilisi Azali.
I'm a person living with HIV and collect my ARVs from the Azalia clinic.
Azalia inkinga esiba khona uthi ufike ngo7 Azalia uthola ukuthi nje isikhathi sokusebenza abanaso.
My problem is that we arrive early in the facility around 7 a.m. but they work very slowly.
Baze baqala ukusebenza mhlambe ngabo 10. Nalapho beqalile ukusebenza ngabo 10 bazoba nesikhathi sabo nje mhlambe ihour lonke ekuthiwa unibhekhishelwa ama-file.
They start working around 10 a.m. but before they actually start working, that is the time that we have to wait for our files to be retrieved.
Niwathola ama-file mase niyahamba niyohlala lapho ekufanele nithole khona amaphilisi. Ngenkathi nihleli lapho nithola khona amaphilisi uthola ukuthi mhlambe kuzongena mhlambe 3 noma 5. Mangabe ubabuza ukuthi yini inkinga ngaphakathi nje bakhamba kancane bakutshela ukuthi nje bazichofela amafoni nje abanasikhathi.
When you get the opportunity to go and collect your tablets, you find that they take about 3 or 5 people. We ask the people walking out, what is the reason that's causing the delay inside the collection room? And they just tell us that the nurses are busy on their phones.
Nithi nisahleli nisalindile uzwe sebenitshela ukuthi sesiyahamba thina siyodla. Singabe sazi ke thina ukuthi thina ingoba mhlambe singalambile njengoba besenzela kancane.
We usually ask ourselves when they leave us while waiting in the queue and say they're going to their lunch break, that does this mean that we're not hungry because they're the ones working slow and we have to wait for them to come back from their lunch break?
Kuyasihlukumeza impela siwumphakathi wakhona eAzalia ngoba manje thina siphatheka kabi ngento eyenzakalayo manje besicela ukuthi kube khona mhlawumbe ongasiza ukuthi sithole usizo ngalokho. Ngiyabonga.
This hurts us as the community of Azalia, and we would really appreciate it if we were to be assisted with this issue.
Sanmo. Sivakashelwa i-mobile clinic ifika kanye ngenyanga.
Where I reside, we have a mobile clinic that comes only once a month.
Ngonyaka iza ka 12.
Meaning it comes 12 times in a year.
Uqala kwami ukuyodla ukuthatha amaphilisi ngawathatha eclinic eNjabulo.
When I was initiated on my ARVs, I was initiated at Injabulo Clinic.
Ay eNjabulo ngiphatheka kahle. Ikona nje ukuthi kufuneka uvuke moya eNjabulo sigibela kabili.
I'm treated very well at the Injabulo Clinic, but unfortunately it's too far from me, so I have to take 2 taxis to get there and also get up very early to be able to get assistance. Other than that, the Injabulo Clinic serves us very well.
Ngikaze ngize ngihlukumezwe ngisho noyedwa. Ukuphela esicela sicela ukuthi sibe neclinic eseduze.
I've never been abused at Injabulo Clinic. The only thing that I would like to request is that a clinic be built closer to where we reside.
Sanibona. Igama lami nguSiphesihle nami ngithi angizobeka okwami mandla la. Ngithi uqala kwami ukudla treatment HIV ngaqala 2018.
I was initiated on ARVs in 2019.
Ngangilandela khambeni ngesikhathi agcina sengilandela umama wami ngoba babengixwaya.
I used to collect my ARVs myself, but eventually asked my mother and my sister to collect on my behalf because they were discriminative against me.
Yeah, babengixwaya kodwa mabengangilandelanga uma ngibe ngimuvele ngala eCaluza ngalande khona because nginayo incwadi yakhona.
But when my mother is unable to go collect on my behalf, I personally go to collect my ARVs. The only thing I avoid is being discriminated against.
Ngiyabonga.
Sanibona. Bengiya eMbalenhle eclinic eMbali. Last year na bengifunda isikole ngina 17 iminyaka. Bengijwayele ukuthi mengiya eclinic yonke leminyaka lena ngiyolanda amaphilisi eHIV na bengiya ngigqoke uniform.
I use Mbalente Clinic, and for years up until last year I used to collect my ARVs while wearing school uniform.
And manje kulonyaka lo sengisiqedile isikole last year na and kulonyaka angisakwazi ukuthi ngigqoke uniform manje bengingazi ukuthi uma ngabuye eclinic iziphi izinto kumele uzenze yabo ubambe mapha ama queue ngenxa.
It was for the first time this year that I had gone to the facility to collect my ARVs without wearing my uniform because I completed my matric last year. I did not know which system they used if you're not a scholar.
Manje bengijwayele ukuthi bengisheshiselwa ngoba bengigqoke uniform manje sengingasayigqokile-ke uniform mengiya ekliniki ngenze njengezinye injwayelo ukuthi ngikhiphe ikhadi bese ikhadi ifile bese ngiyahamba ngiyofutha uma sengiyofutha unesi Nxumalo.
I had an experience that I went to the facility, got my file, took my vitals, and went to get assisted by a nurse.
Unesi Nxumalo mengifika ngibambe iqueue aze athi next ukuthi sekungene mina manje ngaphakathi. Uma ngingena ngizofutha angitshela ukuthi angithatha ifile yami ngiyibeke lapha yabo.
The nurse that was assisting me, taking my vitals, asked me to put my file at a certain place.
Uma eshutha angiyibeke laphana ngangabona ukuthi uyikhomba la noma uyikhomba la ngase mina nje usho ukuthi angibeke phezulu etafula.
I wasn't exactly sure where I was supposed to put my file. I assumed that the nurse was pointing at the table, which is where I left my file.
Ngachiya khona ke ifile ngaphumela ngaphandle ke ngathi sengihleli ngaphandle mhlawumbe ngahlala almost 2 hours kuya 3 hours ngiyaxoxa ukuthi hawu kwenzakalani ngefile yami abantu abangemva kwami bayangena bayaphuma mina nje ifile yami hayi lutho ayiphuma.
I waited for about 2 to 3 hours outside and was shocked at the fact that people behind me were now being assisted before me.
Ngithi mengithi ngiyangena ngaphakathi ngizobuza yena uNesi Nxumalo ukuthi hawu kwenzakalani ngefile yami nesi avele nje anganginakathi awuphumela ume ngaphandle sizokubiza. Angithi ifile usuyifakile la ngaphakathi ngithi mina yebo ifile ngiyifakile ngaphakathi athi phumela ume ngaphandle sizokubiza ngiphinde ngilinde futhi.
I went to ask from the nurse why was it that my name was not being called, whereas I had left my file inside, but Nurse Nxumalo responded very rudely, asking me to go back outside and wait for her to call me in.
Uma sengilinda ngilinde futhi mhlambe nje futhi umunye 30 minutes mase ngiyabona ukuthi ngeke phela manje isikhathi siyahamba manje angizame ukuqamba amanga ke manje ke kuphuma umunye ubaba engambona enesiluthu njenganami ukuthi usonto esontweni kaShem bese ngamcela ukuthi time sicela ukuthi upretend as if ubaba wami lana khona uzosizothethisa lo nurse ngoba manje mina ngathi akanginaki nje mina nje ngoba ngiyingane.
After waiting for an extra 30 minutes on top of the 3 hours prior, I realized that there was an older man who, by the judge of his looks, physical appearance, is from the same church as I. So I requested that we go in, and he pretends to be my father, so that he can help me get the assistance that I needed and get my ARVs on the day.
Uma sengingena ngaphakathi na ubaba lo ngimcelile mase siyangena ke afika mbuze uNesi uthi akwenzakalani ngengane yami la isizi yangifonela ekhaya ithi sihlala isikhathi esingakala lutho kwenzani isizi abesethi uNesi ingane yakhe inangaki baba nakhona futhi uyayiphendula nje umphendula ubaba umphendula nje ngokuhlaza bese yambuza yamtshela ubaba ukuthi hayi ingane yami ina 18 manje kulo nyaka.
When we went in with this gentleman, the nurse asked the gentleman how old I was. She was still addressing him very rudely, and the gentleman responded that I was turning 18 this year.
Abese ngibuza ukuthi ifile uyibeke phi mfana mase ngiyasho ukuthi ifile nje uthi angiyibeke lapha ya abese uthi ilaphi lapha ya mase ngiyakhomba ukuthi mina nanti la ngiyibeke khona ifile bese ithi nanka nje ama-file la abo ama-file kune-cupboard ehlele eduze kwalo futhi uyayifaka khona ama-file athi ngithe mina beka la ama-file ngithi mina uzange uzungitshengise.
The nurse then said I wasn't supposed to put my file on the table. I was supposed to put the file next to where she was sitting. I explained that she wasn't specific with the place at which I was supposed to place my file.
Ubese emva kwalokho athi asiphumele ngaphandle ke uzosisiza sinobaba. Ubese sesiphumela ngaphandle kuqhamuka omunye uNesi sisalindile la bese ngiyamchazela uNesi uthi Nesi yazi la kwenza ukuthi nokuthi abese uNesi engibuza iminyaka ukuthi uneminyaka emingaki mfana mase ngiyamtshela ukuthi ngina 18 abese yangibuza ukuthi baseke bakutshela yini ngeindaba zaka youth la eclinic ukuthi wena ngoba una 18 ufuna ngaba ulandi la ngoba badala abalanda la ufuna ngabe uyolanda lapha enzansi kwa youth.
Me and the gentleman were asked to go wait outside again, and then another nurse came across where I asked and explained my situation about how long I had been waiting. This nurse asked me if I knew or was ever told about the youth zone in the facility, and I explained that I was never told. She helped direct me to the youth zone because she said the area that I was at was for the elderly people to collect their ARVs, but not friendly to the youth.
Ubese angichazela kuNesi bese ngiqedeke ngingene ngaphakathi ke seyangibiza ukuthi ngizofutha. Uma sengena ngaphakathi ngizofutha uyangibamba nje, letha isandla, letha lesi isandla sibeka nje. Yabona nje enza nje izinto zokukhombisa ukuthi uhlaza. Bese ngithi hayi mengisizakele nje ngahamba ngaye ekhaya ngehlisa umoya.
The nurse that was giving us the runaround eventually called me in to take my vitals, and she was just pulling on my hand however way she pleased. I realized that she was continuing to be rude in her behavior and actions, but I decided to calm myself down and just be patient with her so that I can be able to access the treatment that I had come to collect.
And nje lezi zinto lezi ezenziwe lo nurse lo kwangiphatha kabuhlungu manje ngaqala ngazibona ukuthi manje yini lo nurse mhlawumbe ngoba ubona ukuthi ngimncane nginegcikwane indaba enza zonke lezi zinto lezi ngaqala manje ngazizwa manje lo system yami siphansi manje.
Yeah, so because of this experience, I felt as though the nurse was probably mistreating me for being HIV positive as a young person, and that affected my self-esteem.
Yeah, ngiyabonga.
Siyabonga, we're going to recommendations. We are joined by uMzamo Zondi, who is the provincial manager of TAC KwaZulu-Natal. He's from here, Emmarisburg. But before I go to recommendations, you know, yesterday, Le eThekwini, uMama Masondo, district director Balapena, she said to us, when people, one, abantu, mabanga hambi, emtholampilo bengayitholanga treatment. Uthe ukuthi lapha ebondeni, kwi-clinics zonke, zikhona i-contact numbers, zika facility manager, umphathi ka facility manager, and abanye abangaphezulu. I think it is important for us, singumphakathi, some of these things says report, so that sibone ukuthi kwenzakalani, because siyayazi sonke ukuthi kuma clinics ethu kukho ama complaint boxes, suggestion boxes, but as isebenzeli, because you write a complaint yakho laphayana, you will never get a feedback, but you are just like exposing yourself konesi. The other day xa usiza mwatsho yamalwa ugqoka ipanamba neskipe sibomvu ngulowala complain, and iqale kanjalo iattitude. But also, not all nurses, as I said before, there are these nurses who are bad and who are a rotten potato within a bag. And if abakhuzwa bazophela be-affecta the whole bag of potatoes, and singumphakathi sithi onesi bonke are like that, yet not all of them. But also, the facility manager has the responsibility of making sure that both the patient or the user of the services and the provider are happy. What my brother is saying here is not different from the stories abanye abantu aba ill-treatwayo kuma facility ethu. And umuntu decide, you know what, instead of me going through this, I rather stop going to the clinic. And people choose to die in silence, yet services are there. And then when a clinic now has a high defaulter rate, abayazi ukuthi why abantu be default. Yet, the reason abantu be defaulter, it is because of a attitude yonis abafana kunye nones nxumalo. There are a lot of nurse nxumalos outside there who are ill-treating the community. Sometimes some of these nurses, when you go to a clinic, ungacabanga ukuthi bakhiphe imali epokotheni to buy medicines, bakhiphe imali epokotheni to build the clinic. These clinics are a public property, are a state property, which have been built through the taxpayers' money. So there is no way where UNES in a facility is going to treat abantu as if in a clinic yeyakhe. But also, singumphakathi, kukho institution ebizwa as the Office of the Health Ombudsman. La Office of the Health Ombudsman, also you can write to them and lay your complaints as investigated in order for honest facility babe nokwazi ukuphatha kahle umphakathi, because we cannot afford a situation where people are dying not because of izigulo zabo, they are dying because of the attitude of some of the nurses. And some of these nurses, not long ago, this year March, bangena kwisiteleka, they bent tires, closed the gates the clinics zethu, disrupted services. And thina singumphakathi, we never saw anything wrong with that. Yet they were violating amalungelo ethu singumphakathi. I told TAC comrades across South Africa to say, next time, when as unions abones zikwisteleka, zivali gates the clinic, singakhona umphakathi uthole treatment, organize taxis and buses, take umphakathi to the nearest private hospital. Because the problem that we have, honest bethu majority yabo, if not all, abayisebenzisi i-public healthcare system, they use the private, yet they are providing services to public 14. And when they are striking, fighting with the department, sithi mphakathi who end up being on the receiving end, singatholi treatment. And that is not right. And as TAC, even when they were on strike, we wrote to How General Secretary Uzola Sapete, something like that, and others. Because we as TAC, we felt this is a violation of our constitutional right as the public healthcare users. And before Basi Stop a strike Sabo, already we were consulting lawyers to interdict that strike, to say, you've got a right to strike, but your right to strike must not infringe our right to access healthcare services. Everyone has a right to strike, and everyone has a right not to strike. So don't prevent those who want to go to work. Allow them to go to work, but also don't disrupt the services zethu. Because Nina, when you are done with the toy, you go to cabinet care, where. So, and when you look at it, our healthcare workers, when they go to private hospitals, they make appointments because they pay for health services. They don't spend even 1 hour, they are out. And if the things to go through zona, zingenze wakubo in these private hospitals, they will be the first ones to cry loud. So we are human beings, and us going to clinics, nobody is doing us a favor. It is our right to go to clinics, to access healthcare services. And when we go to those clinics, no one has a right to insult us, to ill-treat us. And that's why we are asking, ukuthi asisebenzisane nomphakathi nabonesi, because at the end of the day, honest don't sleep inside the facility. At the end, babuye babakunye nathi kumphakathi, without them realizing the harm which they have caused to us or our relatives. And we do not want a situation where we are going to take it from there. Because if we remember, during the time of apartheid, amaphoyisa bengahlali kwi-community. Because the community regarded amaphoyisa, the SAP, as part of abacindezeli. So, we need to work together. We need to sensitize our nurses. Ukuthi, we understand ukuthi there is a shortage of human resource. E-clinics is ngane, amayeza awafiki in time. But that does not mean UNES must shout at me, must ill-treat me, and all what have you. We need to work together. So our recommendations are as follows. The Department of Health should implement extended ARV refills at all facilities from 3 months to 3 months by end of February 2024 and 6 months by end September 2024. The Department of Health and Health Systems Trust should ensure all people living with HIV are offered a range of repeat prescription collection strategy options, and those enrolled in pickup points or clubs are active. Ensure that reassessment of pickup point options takes place at each clinical consultation to ensure people living with HIV remain satisfied with their pickup points or clubs. Ensure all facilities implement the 2023 adherence guidelines, standard operating procedures with fidelity, including ensuring facility pickup points are a one-stop, very quick ART collection, only visit in under 30 minutes, no need to go to the registry, collect folders, see clinicians, and etc. Ensuring re-establishment, implementation of quality adherence clubs, including group facilitation component. Increase the number and type of external pickup points to ensure urban, peri-urban, and rural clinics have external pickup points. Ensuring people going back to clinics for their pickup point rescript receive the rescript on the same day if clinically well, to ensure no unnecessary additional facility visits with effective recall system to action any abnormal results or elevated viral load. PEPFAR should monitor and hold accountable PEPFAR district support partners to implement 2023 adherence guideline standard operating procedures with fidelity.
The next group of issues are on art continuity. People living with HIV lead complicated lives and may well miss appointments and even miss taking some pills. When they do, meeting them with support when they return to the clinic helps ensure long-term adherence. But often, when people living with HIV and key populations return to the clinic, they are treated badly, leading to people disengaging from care. A differentiated service approach is required for people living with HIV who re-engage in care. Some will require intensive clinical management, including advanced HIV screening and management, while some will require psychosocial support in the form of quality counseling and group support options. The majority needed be made easier to collect treatment. These people should be offered multi-month dispensing and should be assessed and offered access to pickup points or adherence clubs as quickly as possible. Implementing 2023 re-engagement, clinical and adherence guidelines are vital to supporting improved long-term adherence and retention. Health Systems Trust should support the remaining 17% of facilities and all others in the district in training or mentoring on the changes in the new 2023 adherence standard operating procedures. Ritshidze data reveals that out of 776 respondents, only 68% of people thought that the staff were always friendly and professional. This graph shows data across time since data collection began in the district. The district should continue to improve to ensure all people living with HIV, key populations, and other public healthcare users are treated with dignity, respect, and compassion at all times. It is also important to note that because Ritshidze interviews take place at the facility, people who have already disengaged from care due to poor staff attitudes, some of who we heard from today from our community stories, would not be at the facility to be interviewed. The best performing sites on staff attitudes are outlined in the table shown. And here are the worst performing sites that need improvement. Out of 81 people living with HIV who had missed appointments, 57% said that staff were welcoming when they came back to collect ARVs if they had previously missed a visit, and 35% said that staff counseled them on adherence. However, 15% said that staff still send you to the back of the queue in the next time you come in. Yet, according to the National ART Guidelines and Differentiated Model of Care Standard Operating Procedures, People should not be sent back to the back of the queue or made to wait until the end of the day to be seen. A returning patient should take up the next queue space. The guidelines specifically state that no punitive actions are allowed. People should join the queue as normal on arrival at the facility, irrespective of whether on time or late for their appointment. Punitive actions lead to people deciding not to come back again. We need to normalize late and missed appointments without penalty. People who have come back despite being late have made it easier for the health system. It is not necessary to track and trace them and encourage them back into care. The person has stepped back into the facility so that experience should be as supportive as possible. Psychosocial support is another critical element to ensure long-term retention. Ritshidze data reveals that only 74% of people living with HIV interviewed know that psychosocial support is available. Further, a full package of psychosocial services are not yet available at every facility. A full package of services should include provision of individualized, quality-assured counseling to patients, peer-led patient navigators acting as a bridge between clinicians and patients, mapped networks of referral services, optional support groups, and food parcels. As part of psychosocial support, support groups should also be linked to each public health facility that are critical to provide counseling and support services to people prior to testing, post-testing, pre-treatment, and those struggling on treatment or re-engaging in care after a treatment interruption. Treatment literacy also improves ART continuity as people understand the importance of starting and remaining on treatment effectively. Of the 381 people living with HIV surveyed, 98% had received a viral load in the last year, yet only 76% reported that they knew their viral load. Further, only 67% knew that having an undetectable viral load means the treatment is working well, and only 67% knew that having an undetectable viral load means a person cannot transmit HIV. There is still much room for improvement to reach other higher performing districts where as many as 100% of people living with HIV understood why an undetectable viral load is important. 6 facilities had perfect scores where all people living with HIV understood why an undetectable viral load is good for their health. However, other facilities performed much worse. Six facilities had perfect scores where all people living with HIV understand why an undetectable viral load is good for ensuring you cannot transmit HIV. However, again, other facilities performed much worse. And now we will move to recorded stories for this section.
Ngihlala eWillowfontein kwaphupha ngisebenzisa ikliniki eWillowfontein ngike ngaya khona mina amaphilisi ama-ARVs bathatha khona ngaphakathi hayi cha angikaze ngihlangabezane nenkinga banekhe kuleyo department if mhlawumbe ngizongabibikho la like 2 months or 3 months ngiyasho ukuthi angizubabikho bayanginikeza alingene lokho abantu abanenkinga nje lo asiso lapha kwi-reception unenkinga futhi mhlawumbe ngisazowathola amanye ama-cases ngoba ngabuka ukuthi akusemina ngedwa okhala ngayo ngaliyelala ngangikhona abaningi impilo yakhona-ke ekuthenini umoya ofuna ifayili yakho ayikho ifayili like angithi kunamamakhadi amancane lamakhadi amancane aney'namba leya namba leya ekuyiyona engicabanga ukuthi ikhona lapha kwifayili iyona abaphantsha ngayo la kwikhompyutha then abese uyikhipha ifayili yakho uzokuphantsha la kwikhompyutha uzovela kodwa ifayili ngeke azayithola eklinikhi mangabe ngifike ngo7 iklinikhi ivula ngo7 ngiyazi ukuthi ngo9:30 ngizobe sengila ekhaya asihlale eklinikhi isikhathi eside into esihlale seklinikhi isikhathi eside leyo kulahleka kwefayili ngoba ayikho into ozoyenza ifayili ungenayo ufuna uhlala ulinde ayifune uma ngabe engayitholi le file shuthi wena ngalelo langa usizo ngeke ulithole bathola umuntu okwazi ukusebenzisana nabantu la sisakwazi ukusebenzisana nabantu abathola umuntu okwazi ukusebenzisana nabantu bathola indlela yabo yokuhlela kahle ama-file ethu because ayaduka ama-file mangabe ufikele mangabe umiswe i-date eklinikhi wena uyoba owokugcina uma kuwukuthi akade benama-date namhlanje like noma ngingafika ngo-7 uma kuwukuthi bengimise i-date ngiyoze ngingene ngo-4 kuzovalwa iklinikhi uma kuwukuthi babasebenzi babaqeda bangalolo suku if bengabaqeda bangalolo suku shuthi nami ngiyajika kuyoze kuphele abangakusasa then bese ngiyasetshenzwa akukho right ukuthi kungathiwa angizusetshenzwa sengifikile eklinikhi ngoba nginesizathu angeke ngihlale la ekhaya ngingayi kolanda i-treatment yami like ngizihlalele nje kungekho into ekhona sineyingane sinemindeni ekude kwenzeka noma yini sekufuna wena usukumele phezulu uye lapha ngiyazi ukuthi mengabe kuthiwa like ubaba la ekhaya kahlala ekhaya mekuthiwa nangibaba la ekhaya unenkinga usebenza nomsebenzi obucayi mekuthiwa nangibaba la ekhaya unenkinga le msebenzi ngifuna ngiphuthume khona ngiyazi ukuthi ayivele ngizobuye ngiye eklinikhi uma usufika eklinikhi-ke kuthiwa ngoba wena udlulwe i-date yakho uzolinda kuqale kuphele abanamhlanje officially akukho right-ke nje lokho-ke
ngicela ukuba anonymous ngiqhamuka eThelasi ngibe ne-story la since ngingasebenzi ngibuye ngingabi nayo imali yokuhamba ngiyolanda amaphilisi eklinikhi uma ngingawalandanga amaphilisi mase sengizowalanda bangenza ngibe umuntu okugcina bathi ngizogcina ngobani angiyenzanga i-date nanokuthi ma ukuthi bathathile hlampa amagazi abakwazi ukuthi bechazele ukuthi njengoba kukanjena wenza kahle noma wenza kabi bathatha amaphepha bawafake nje kwifile usuyoyibonela ke wena ukuthi kahle kahle khamba kahle noma khamba kabi ngilanda wengculazi nama results ethu abasichazile bavele benze nje ngeyabo indlela mhlambe kule nyanga nje mina ngwalana mhlambe u2 months kulo ngizothola awunekopozela imhlophe kulawo okopozela imhlophe mhlambe peach kuloku okulandelayo sengithola ikopoloze blue asemhlophe yabo bashiyana kanjalo ukwazi ukuthi mhlambe kube inyanga ezilandelanayo uthola amaphilisi a-right kwesinye isikhathi uyawathola uthola ukuthi lawo maphilisi awakuphathi kahle kodwa ngobani awubuzwa lutho bona bakunika amaphilisi-ke ugcina ususebenzisa kwesinye isikhathi ugcina usuthi haya ngiwaphuze azongenza inhliziyo encane ugcina usungasawaphuzi-ke amaphilisi mina njengoba ngiwalanda ngaphandle ngifike nje banginika igobhoza ngithi suke lifakwe ekhalibhothini manje angikwazi ukuthi ngibone ukuthi ikhalibhothini njani nenjani ngangabuza before ngisamithi ngathi mina lamaphilisi bathi inkinga awafiki ngeke ngikwazi ukuthola amaphilisi afanayo izinyanga zilandelana ngobani bona balethelwa amaphilisi mase kube ibona abasinika yona abakwazi ukwenza ukuthi ngithole mhlambe a blue insuku zonke uthola noma yiphi inhlobo esuke ikhona ngaleso sikhathi engifisa nje bakwenza ukuthi mhlambe besidonsa amagazi njengoba ngidonsile mina ngoMarch ilokhuzane yami annual yami ngoMarch abakwazi bona ukuthi mawufika mhlambe bakubonisa iphepha uzibonela wena iphepha seli-establishiwe kwifile
ngihlala eSnathing ngisebenzisa eSnathing clinic ngidla ama-ARVs ngangaya ngedate yami ekwakumele ngiye ngayo ngaya emva kwa7 days namaphilisi asengiphelele ngafika ekseni ngabo past 6 ngoba ulayini uba mningi sibaningi naseklinikhi istaff siyashota mangifika ngibamba ulayini kuze kube ngene reception ngabo past 9 mangikhiphela ikhadi usister bheka ikhadi lami and wathetha ukuthi umhlakabani namhlanje kwakumele ngize mhlakabani bengihlalele zonke lezi insuku uzogcina ngami okay kwangiphatha kabi lokho ngahlala ngaphandle ngalinda kwashayo 2 kwashayo 3 kuyavalwa ngo4 kwaukuthi sekufika ukuthi kuyavalwa ngibuza ukuthi ayibo ngibona seniqoqa ngenze njani sengikhuluma nomunye angikhulumi nalo kade ngikhuluma naye abuza ukuthi awuyini ubuzokwenzani ngisho ukuthi hayi usister engene kuyena wase wathi angilinde ngaphandle bazogcina ngami wangiphendula usisi ukuthi cha njengoba nje kuyilesikhathi bona sebeyama angiphinde ngivuke ngakusasa so nje kwangiphatha kabi lokho ngavuka nangakusasa mangivuka nangakusasa ngihlala eminyango kuthi mase sekusetshenzwa ngabo 8 ngingene ngaphakathi ngisho ukuthi mina lo kade ufika izolo bangichika ukuthi ayi wena sogcina ngawe na izolo ngishonja ngisho ukuthi na izolo nishonjalo ngenze njani bagcina bengibonile nje kodwa bangibona late ngabo 2 ave kuyinkinga lokungiphathanga kahle aye ngasekho nje kwangisukumisa ekhaya ukuthi aye ngasekho amaphilisi
ngihlala eHewudi ngisebenzisa iCaluza Clinic for ukuthatha i-medication yami noma mhlambe kukhona umuntu ongithumile ngiye khona for lokho kwakuMarch ngikhumbula so kahle ngangithume umuntu cause yena naye uthatha i-treatment lengithathayo so why akekho available ngenxa ukuthi uyasebenza but ke into eyenzeka cause ngafika mhlambe ngabo 12 mangifika amafayili kakhishwe so ngayitshela ukuthi since ngizolandela umuntu mhlambe kuzoshesha kodwa into eyenzeka lapha ngahlala until kwashaya u6 kuze kufike onesi basebusuku makwenzeka lokho into eyenzeka enye futhi eyiba nokuthi khona inkinga abanayo leyo nto emergency mangabe ku-emergency bamane bahambe bonke onesi lapha bo-attenda lo emergency bakhohlwa ukuthi nathi sihleli la nathi sidinga usizo and sidinga ukuhamba ileyo nto into eyayenzeka-ke ngalelo langa and nalento yamalantshi kabo la umuntu athatha 2 hours welantshi angi-understand kodwa-ke into eyenzeka ngagcina amaphilisi engingabuyanga-ke nawo amaphilisi omuntu-ke lawo cause ngahlala until kwasha u6 ngagcina ngimtshelile ukuthi hayi cha angiwatholanga and leyo nto-ke kusho ukuthi sekudefault-ke lokho and lapha eklinikhi uma usudefaultile bakuthethise ngazi ukuthi i-fault yakho cause wena usuke ufikile eklinikhi and nefayili izosho and ngamtshela lokho that ifayili izofika itshela ukuthi cause kuyagxivisa sofika itshela ukuthi bengifikile kodwa still i-treatment awangiyitholanga ngesimanga sokuthi onesi bebenza kancane hayi into eyenzeka-ke phela-ke ngamnika ama-13 days ukuthi akaphusheke lapho and then waya ngedate elandelayo-ke kwakumele aye ngayo vele yiloko kwenzeka
Sanibona, Bongiwe Mchunu lokhu. Mina ngisebenzisa uBomb Street Clinic lo sedrobheni eMaritzburg. Hayi bandla kuyasebenzeka onesi bakhona ngizobancoma bandla bayasebenza.
I use Bomb Street Clinic. I collect my ARVs there and the nurses service us very well.
Engakhala ngakho nje kodwa nje ngingathanda ukuthi mhlawumbe mangenzeka ushintsho odokotela bakhona bakwazi ukusibona phela ngoba nemizimba yethu ayifani. Bakwazi ukusibona odokotela ngoba nemizimba yethu phela ayifani sinenkinga yemthambo lama kufanele sithatha amagazi.
We are different individuals. I particularly struggle when they're supposed to draw blood. My veins are not as visible as they would want them to be. So I believe that they should refer some of us that have the same problem to the doctor.
Bese kuba khona ke lokho kuzoba inkinga ke encane ngoba phela angeke babe bahle bonke abantu uzoba khona nje lo mbona uthi ngathi nomsebenzi wakhe akanayo indaba yawo.
In as much as the clinic services are good for me, there are people that do not service us properly. That is something that I would consider to be a small problem, but I also would like to highlight it.
Last limala khona ke abanye bethu abanenkinga yemthambo ecashayo. Uthola ukuthi uzokuthintwa unesi ongakwazi ukuza umthambo wakho ukuthi ungalaphi. Uthola ukuthi ngaleso sikhathi ekuthinta ubhizi uchofoza ngenalithi. Ukubophile uchofoza ngenalithi kubhlungu umthambo wakho awuveli.
The reason why I'm asking that we be referred to the doctor for drawing our bloods, especially for people that do not have visible veins like myself, is that the nurses keep on injecting, using the injection to try and draw blood from you countless times, and it's painful.
Ngaleso sikhathi kubhizi uyachofoza uyayixoxela nje nomngane wakhe uyambheka nje futhi lo muntu akezwa nokuthi wena uzubuhlungu njobe ebhizi lekutesta ngenalithi la engalweni.
During the time when the nurse keeps on stabbing you with the needle, they're having a conversation with their counterpart or busy pressing their phones, so they're not necessarily paying attention to the type of pain that they could be inflicting at that time.
Ngaleso sikhathi ke uzothi usothi masebonile uthi ayingeke uyahluleka akakwazi ukuthola umthambo wakho ucashile sekuyima ekuhambisa kudokotela ozokwazi ukuzwa ufile yena uthi umthambo wakho ukuphi.
After stabbing you countless times with a needle, the nurse will then refer you to the doctor, meaning you have to come back the following day to draw blood because then they have failed to draw your blood with success.
Uthola uthi uyafika ke kudokotela ozokwazi ukuzwa kuzokuthinta kancane udokotela shesha kuze uthi umthambo wakho uphafaka inalithi uphuma igazi kusheshe kuphela.
From personal experience, whenever I'm referred to the doctor, they just draw blood in one try, and I believe that for future reference, they should just refer me straight to the doctor instead of having the nurse try.
Manje ebengingafisa ukuthi kwenzeke nakhona ke emaklinika onesi nodokotela ababe nendlela yokwazi ukuthi umuntu onemthambo nongenamthambo baba ngalapho ukuze laba abazi ukuthi banenkinga yemthambo basheshe babone udokotela lo okwazi ukusibona thina singenayo imthambo ngesikhathi. Angazi noma lokho ngingakwazi mhlawumbe ukuthi sithole usizakala nangalapho ngoba ibhlungu ngempela lento ukuthi unesi uzobabhiza kutestele umzimba wonke lo ekuhlaba ngenalithi kuzothi ekugcineni usebonile ukuthi ayingeke umthambo awutholakala sekuyima ekusa kudokotela okwazi ukuthi akusize. Ngiyabonga.
Sanibonani. Igama ngubhuti ngwasekhaya. Mina sami story sithe ukuhluka kancane kodwa sicishe sifane. Ngisebenzisa iclinic eMafakatini ngicollecta khona medication. Yama ARVs.
I use Mafakatini clinic to collect my ARVs.
Kwathi early this year around March ngathola i-offer empendle kwamele ukuthi ngiyosebenza nenye team yakhona ngiyoyicoacha, so kwaphoqa ukuthi ngithole i-referral letter from eMafakatini to Mpendle.
I requested for a referral letter from the Mafakatini clinic to Mpendle clinic because I was relocating because of work-related issues.
Ngiya khona eMpendle ngahamba ne-medication yami eyanele nje inyanga yonke because ngaya uMarch nje uqala. Kwathi sekusele around 20 days ukuthi inyanga iphele ngase ngiyahamba ngoconsult clinic la khona eMpendle ngafisa ukuthi ngithathe khona i-medication base bethi angishiya ama details ami bazobuye bangifonele ngifike khona ngizothatha amagazi.
I went to the Mpendle clinic 20 days before I ran out of my ARVs to present my referral letter, and they took my details telling me that they were going to call me back to the facility because they needed to take a viral load test before dispensing ARVs to me.
Then kwahambe isikhathi kwathi sakusele aboma 5 to 6 days aphela ama ARVs wami ngase sengiyabuyela khona ngababuza ukuthi kwenzeka kanjani ngisalokho ngilindile kodwa anikwazi ukuthi ningixhume ngibona isikhathi siyahamba base bangithatha kamagazi base bethi angobuye ngibuye.
I went to the clinic again because they had not called me. When 5 days before I ran out of my ARVs, they immediately drew blood and asked me to come back for the results.
Then emva kwalapho kuthe sekuphele athi ngiye bangithatha amagazi kulo 6 days ususele ngishuthi ngisalelwa amaphilisi awu6 kuthe sekuphele lo 6 days kwazi kwagama ncela ku 3 days osengingase nawo khona amaphilisi ngase ngiyabuyela ke ngababuza ukuthi kwenze kanjani sengihlala u3 days wonke ngingawaphuzile amaphilisi lapho ngazi ngasukuma ngase ngaveza ukuthi phela ngiyimember yaka TAC ngizokusukumela lokho base benza ngokusheshsha banginika amaphilisi ami. From lapho ke ngaqala ngathi hayi ngizolokhu ngidrive njalo ngitravela njalo from Mpendle to Mafakatini ngase ngifuna ukuthi ngibuyele khona eMafakatini ngoba eMafakatini yami yonke into ibihamba kahle.
I went back 3 days after I ran out of ARVs, also asking why I was not contacted to come get my viral test results and be given my ARVs. I was not paid attention to until I disclosed that I was a member of the Treatment Action Campaign and I was going to take this further. That was when they then paid attention to me, took me seriously and gave me my ARVs, after which I decided to go back to my original clinic instead of using this one because I'd never had such problems at my previous clinic.
Ay, ngibonga kakhulu.
Ngiyanibingelela igama lami nguGogo ngisebenzisa iclinic lase Azalea Azalea clinic ngesinye isikhathi uyahlala isikhathi eside lokho kusuka kwenziwa ukuthi istaff asikho uma kukhona unesi ongekho akekho umunye osesikhundleni sakhe oyireliever lakho ukuthi uyena kufanele amsize.
I use Azalea Clinic. And the challenge that we experience at the facility is the shortage of staff. For an example, if one nurse is absent or not at work on the day, they don't replace them with anybody because there's no one to replace them with.
Namafayile ayalahleka ngoba kwesinye isikhathi lo usakhipha amafayile usuka ngeke ugcine usuthola iphepha. Leli phepha ukwazi uma ngabe uyobona udokotela kuya ngalo kudokotela.
Files also get lost and they give us temporary files, but it's difficult for the doctor to be able to trace your medical history with just that temporary file.
Mawusuthathe ngalo leli phepha amagazi akho awuwatholi ngoba leli phepha ngithi ushile musuqedile alikho efayilini yakho.
What usually happens in the case of a temporary file is that if they used it when you came for your viral load test, you will never get your results. You'll never receive your viral load test results because there was no way to file them. So you'll have then to take another viral load test when you come back to the facility.
Sanibona. Yebo. Sebenzisa uMedicine Clinic. Ngangihambisa ingane yami eClinic kaMedicine. Ngafika ngabo 7 kwaze kwashaya u3 ngingaphakathi.
I use Mason's Clinic. I had an encounter when I took my child to the clinic. We arrived around 7 a.m. and left. We were only able to go inside the facility around 3.
Singeneke ku sister ngaphakathi ingane yami ayizodonsa amagazi. Angibuze usister ukuthi ngizokwenzani. Ngafika ngalesikhathi ngithi mina ingane izodonsa amagazi. Athi hayibo pho ngalesikhathi ngithi mina kade ngifikile la ngifike ngabo 7.
The nurse questioned the time at which we walked into the consultation room after she found out that I had brought my child for their viral load test, and she asked why was it that we had arrived so late. I explained to the nurse that I had arrived early in the morning but was delayed in the queue.
Athi pho manje mawakha umkhumula ingane jacket. Ayingikhumula ingane jacket. Emva kwalokho ayifaseke ngeglaves ke eyilo. Eqala ukuyidonsa igazi. Ngesikhathi eqala ukuyifaka inalithi awufaka emthambweni eronki. Ingane itsazi igazi aqeda thatha ukhothinuli angijejele ngokhothinuli. Ngibone ukuthi kumele ngiyisulele mina ingane.
The nurse attempted to draw blood from my son's arm, but I suppose maybe she did not insert the needle in the correct place. So there was blood all over the place and she threw a cotton wool at me. I assumed that she meant that I was supposed to stop the bleeding using the cotton wool.
Uthe jika lapho ke wayilokho ijoja ke funa umthambo ke lapha ingane iyakhala akawuthola umthambo. Uthe sayijoja kanjalo ukuqhamuke omunye usister shothi akasebenzisana naye uphethe ikhekhe lephathi athi awukaqedi ukusebenza athi lo angaqeda abuza ukuthi sebebangakanani abalindile ngemuva athi hayi basekhona impela abantu bakho shothi hayi usazohlala.
As she was attempting to draw blood from my son's arm countless times, another one of her colleagues came through with a birthday cake. She was holding a birthday cake, asking the nurse that was assisting us at what time is she going to finish. And the nurse was unable to respond, asked the colleague to tell her how many people were waiting in the queue for her. And when the colleague explained that there's still a lot of people waiting, the nurse seemed to be irritated.
Ingane yagcina ingawadonsanga amagazi ngoba wajike sethi ayike mawakhe mina ngiyamyeka ke shuthi senizobona udokotela lapho usokuli ulesibili ingane ngilovisile esikoleni udokotela ufika mokulesini ngabona ukuthi ngizoqala maphansi futhi ngibuyele kulesine ekubeni ngibe ingane ngiyicela esikoleni ngayeka kunalokho into engayincamela ukuthi ngiyenze ngancamela ukuthi ngithathe transfer ngihambe ngiyisenodale.
The nurse eventually failed to take the viral load test and asked me to come back another time, come for the doctor on a Thursday. This was on a Tuesday, and I'd already made my son absent from school. So it was going to be a challenge to get the child not to go to school again on a Thursday. On that very same day, I then requested for a transfer letter or a referral letter and switched the clinic.
Ay ngitheme ngiphuma ke sengiphuma sengihamba ke sengicikekile nje. Ngitheme sengithi ngiyadlula ngasewindini awu la eceleni kwakhona la ngikhipha ingane ade khipha khona amagazi so kuyiphathi ngabona ukuthi njengoba de George ingane yami ngenalithi ubejaha ukodla ikheke.
As we were walking out, I realized that there was a birthday type of setup in the next consultation room, and that made me assume that as she was stabbing my son with a needle countless times unsuccessfully to take the viral load test, she was rushing to go to the party.
Sanmanan, mina treatment ema ARVs, ne treatment ye depression.
I am on ARVs and depression medication.
Ikliniki engaqala ukuyisebenzisa isempendle. Ikliniki esasisebenzisa ngaleso sikhathi empendle kusemakhaya kakhulu. So ayikho even transport ekuthatha from la uhlala khona uya eStepmore la kukhona khona mobile.
I was initiated at a very rural clinic, and my rural setting forced us to not even be able to get transport to travel to where the mobile clinic would come.
So into esasiyenza sasiwalka ngeenyawo sisuka endaweni ekuthiwa iselotheni ekhathikathi siwalke siye Stepmore is too far. Sihambela ubala sibuya ama-ARVs ngaphethe amaphilisi.
We would then be forced to walk very long distances to try and access our ARVs, but unfortunately we would sometimes have to come back home without accessing those ARVs because they would tell us that they didn't have them at the clinic.
Ngokuhamba kweminyaka sebuye kwazanywa-ke khona endaweni ekuthiwa iselotheni yakhiwa ikliniki ekuthiwa iMahlutsheni Clinic.
Luckily for us, they eventually built a clinic for us called Mahlutsheni Clinic.
Into ebuhlungu yakhiwe ikliniki eMahlutsheni, but abantu balaphaya elotheni abakhona ukusizakala because sometimes even there eMahlutsheni Clinic abayitholi kahle treatment yabo.
It is still unfortunate that in as much as the clinic was built by people that still try access for ARVs or other services at the clinic are returned without accessing their treatment.
And in there yangisiza more especially because i-treatment ama-ARVs bengwadla kahle. I-treatment kade ingadleki kahle kakhulukazi ile ye-depression.
In as much as there were struggles with accessing my ARVs, I would honestly like to say that they would be out of stock of my depression, antidepressants treatment compared to the ARVs.
Kushuthi ngathi into yangisiza ukuthi ngize ngigule kakhulu ngi-admithwe la eNodeli la ngatholakala khona ukuthi sekufanele ukuthi ngize ngidle i-treatment ye-depression. Uma ngabe sengidla i-treatment ye-depression laphaya eMahlutsheni akukho ngisho ama-psychology asiza abantu ukuthi ababone ukuthi mhlawumbe umuntu angaze agcine sekutheni usedla i-treatment. Akukho ama-psychology, umuntu megula noma kuthiwa ugula ebusuku ufuna kuze kuqashe imoto kuyabiza kuyiwe empendle edrobheni. Makufika empendle kuyikhathi kufonela eMaritzburg kuthiwa umuntu udlulisele eMaritzburg idindeli noma eNodeli.
The facility is not a 24-hour facility, and it also does not have any mental health related services. This is where I realized the struggle of not being able to access my antidepressants at the facility.
Bengingacela bandla ukuthi basisize ngoba indawo yakhona inkulu kakhulu ukuthi leya clinic at least isebenze u24 hours ukuze umuntu megula akwazi ukusizakala angaze aqashe imoto angene ezikweletini ukuthi ufuna ahambe ekaye empendle uyoza thola usizo empendle edrobheni la kuna u24 hours khona nakhona phinda adlulisele eMaritzburg enye imali leyo cela ngathi bangasiza bafaka ama psychology khona emahlutshini clinic bakwazi ukusiza abantu ngoba inkinga zabantu ziningi kakhulu la ngaphandle.
We would really appreciate it if the Mahlucheni Clinic were to be made a 24-hour facility, and instead of having people go into debt and borrow monies to make it to a 24-hour facility, we would also really like it if psychologists or social workers or any other mental health related services were to be made available at the Mahlucheni Clinic.
Okugcina ngicela manje iclinic engiyisebenzisa iAzalia neMbalenhle ngicela bandla itreatment yami angiyidli kahle ngenxa ukuthi mangiyolanda itreatment yedepression eAzalia bathi eMbalenhle bawalethile amaphilisi ngilindileke mina ngithi kusho ukuthi ufuna ngiyifeke mina ngeke ngibabuze ukuthi ngifuna ukuthi ngiyifeke mina ngoba sithi ngiyangidilfotsisa phela manje ngawalandi mina ngiyeni ngozilandela bathi cha linda ngilihlaleke ngilinde ukuthi amaphilisi awaphelela awekho right.
And lastly, because now I'm this side and no longer living or residing in the rural area, I use Azalia and Mbalenhle Clinic. So Mbalenhle Clinic is responsible for bringing my antidepressants to the Azalia Clinic. But whenever I go to Azalia Clinic, they don't have my antidepressants. I end up asking the nurses if I should personally go to Mbalenhle Clinic to collect my antidepressants. But they always advise me to wait until Mbalenhle Clinic delivers the treatment. But this worries me because I skip a lot of my treatment.
Okay, ngiyabonga.
Sanibona.
Yes, baby.
Sanibona. Thandekile Ndlovu lo. Ngisuka eSnathingi ngisebenzisa eSnathing Clinic. Mina ngilanda treatment ye HIV.
I am on HIV treatment and collect my ARVs from the Snating Clinic.
Uma ngabe ngiya khona ngolanda amaphilisi angiphathe kahle because ngumuntu obamba amatoho so amatoho awekho stable ngiyafonelwa mekabe kufanele ngizwe etorhweni uthola ukuthi kwesinye isikhathi ngizofonela kanti idate yami yokulanda amaphilisi.
The only challenge that I have with the clinic is how it interferes with my employment schedule. I'm not a person that is permanently employed. I get called once in a while to attend a job that I might have at that time. And when the job date clashes with my ARV collection date, that gives me a problem.
So ngike ngidecide ukuthi ke mengabe ngowalanda kuqondene nosuku lokusebenza ngike ngihambe ekseni ngo4 ngenzela ukuthi mhlambe ngisuke ngithi ngisizela ukuthi mhlambe kuzoshaya u9 sengikwazi ukuhamba ngemsebenzini kodwa akwenzeki because ngihlala ngo4 to past 4 gateini uthola ukuthi izoze singene ngaphakathi ngo7.
I usually go to the facility around 4 a.m. when I have to go to work, and hoping that I would be able to get my ARVs and be assisted, probably leave the clinic around 9. But this never happens because we wait outside the gate from 4 a.m. to around 7 a.m. when they open the facility.
Uthola ukuthi mongabe singena ke ngo7 akuzuqalwa ukusebenza ngo7 mhlambe kuzoba khona ama morning prayer emva kwalokho bathi bayahamba baya kwi meeting i-meeting ithathe 2 to 3 hours.
What happens as soon as they open the facility is that they have a morning prayer session and they have a staff meeting which can take for about 2 to 3 hours before they start working.
Emva kwaleso sikhathi ke mase kuyaqala ke kuyasetshenzwa ke kubhaliswa ama dates lapha reception uze kuyongena ngaphakathi ke kunesi ku sister la uthatha khona amagazi uthi uma ufika ngaphakathi seko 12 seyathetha angeke sakwazi ukuthatha amagazi namhlanje manje ufika ngalesikhathi nifike nilale mase niyavuka nizala seniqede yonke into eniyenzayo emakhaya.
At the time that you manage to get into the consultation room, the nurse scolds you for arriving late, accusing you of not coming to the facility very early and choosing to sleep other than coming to access the services. When you explain that you had arrived early, they don't listen to you and they don't pay any mind to what you're saying.
So hayi kuyasibulala kabuhlungu ngempela thina esinamatoho ngoba sisuke sincengile nakubelungu. So umlungu uma ngabe uzonikezwe enye date thola ukuthi nangaleyo date uyasebenza kuzophinde kwenzeke futhi the same thing. Baphinde bakuthethe ayi ngoba bayathetha badla shame.
This is very inconveniencing because you ask your employee for a day off and don't get assistance, and then you have to ask for another day. You are now having a problem with your employee where you cannot make it to work, but also are not being assisted at the facility. Instead of being assisted, they scold you because that is what they are best at doing.
Thank you. We want to acknowledge Umama Mtungwa, who is a TP coordinator, osekafikile phakathi kwethu. Also, I think we need to give a round of applause to these facilities which are doing well in terms of being friendly and professional towards the healthcare users, but also sicele ukuthi it will be good if the worst performing facilities zingalekelelwa in order ukuthi nazo zibe noba kule level of the ones that are performing well. But also it is important to note that turning people away from the facility or make them to stand right at the back of the queue because they missed their appointment, that is not a standard operating procedure of the Department of Health. That is illegal, that is unconstitutional, and it will be good apha uMgungundlovu klama facility alapha around bangasebenzana nathi ukuthi bayeke that thing because it is against the Constitution. There is nothing in the Constitution or the National Health Act which says if you miss your appointment, the following day you will be turned or made to stand right at the back of the queue. It is unconstitutional, and ayuvise kahle umphakathi. And if umphakathi, all of them, they knew their rights, they can sue these health establishments for this wrong practice. And I think it is important ukuthi abaphathi bama facilities abakhoyo apha baze with another way, except lena ukuthi ufike ngo7 because I missed my appointment undenze ndiyome back. Nami mzamo, I am a public healthcare user, not by force but by choice. I normally go to clinics from 7 a.m. before baqala usebenza until 1. All our clinics, most of the times, more especially the primary health care centers, after 1 o'clock, akukho busy kwi-clinics zethu, kushaya umoya. So the question is, instead of turning away people who miss their appointments, why a clinic does not make an arrangement yokuthi from 8 while school busy and the clinic is congested until 1 o'clock, let's attend abantu who came, and then all those who missed their appointments, we attend them after lunch. Because after 2 o'clock, if you go to a clinic after 2 o'clock, the only people who are there are few and abantu abaklenayo. And I think if that can be communicated to umphakathi ukuthi instead of waking up go 4 a.m. for collecting your medication because you missed the appointment, rather do your things and come after 2. Then people get the medication. But ukubekho usisi lo ungaphaya lona ucollecta i-treatment azaliya nasembalenhle. I think what is happening kusisi is unfair. uya kwenye clinic to collect a treatment of this, aphinde aye kwenye. And if it happens ukuthi the same day she's got appointment in these two clinics, she's unable to divide herself into two. Danicela baphathi singahambi apha singamsizanga usisi. Sibone ukuthi singenza njani ukuthi i-treatment yakhe ayithole kwi-facility A1, because idla isikhathi sakhe, idla yonke into yakhe, and also uya accused kwezinye instances ukuthi she missed the appointment, yet she had an appointment with another clinic. Dacela, please. Sizaya ku recommendations. As we are going to recommendations, Mzam, I also serve Mzam. I am a board member in the Office of the Health Standards Compliance. You know, when I sit in those meetings of the board, getting reports of a performance of facilities, I always fight, and they are calling me Julius Malema, and I always tell them I'm not that. Because for me sitting there, I happen to be privy to the information in it. And what frustrates me, the reports is taller with Office of the Health Standard Compliance, and the reports that are coming in meetings like this and the testimony of the community are two different things. And one of the things now that we are pushing there is to take punitive measures against health establishments which do not adhere with norms and health standards. Because we are preparing for NHI, and we want NHI to be implemented in the country. In order for the NHI to be implemented in a particular facility, a facility must get a certificate from the OHSC of compliance, which is valid for only 4 years. And when you see these reports, you know this clinic, and this clinic, it has been given a certificate. And I always ask myself, how did it happen, a clinic that has infrastructural problems to be given a certificate? So I'm trying to say, we need to work together here. We need each other as a community, because without nurses, we are nothing. But also, without patients, nurses cannot practice their profession. That's why it is important that always we work together to make sure that we protect the rights of the users of healthcare services, as well as the rights of the providers of healthcare services. Our recommendations are as follows. The Department of Health should ensure that staff acknowledge that it is normal to miss appointments and or have treatment interruptions. People living with HIV returning to care after a late or missed scheduled visit, silent transfer from another facility, or treatment interruption should be welcomed. That's why we've got what is called a welcome back program. A welcome back program is designed to welcome back with open arms all those people who might have disengaged on care. And when they come back to the facility, we must not put them on interrogation room or insult them, because the welcome back program is not about that. It is about providing quality healthcare services to the people. Ensure Department of Health staff treat people in a dignified and friendly manner, and investigate any reports of poor attitudes raised by Ritshidze and take disciplinary actions where appropriate. Send communication to all sites highlighting that no person living with HIV should be sent to the back of the queue if they are late for or miss an appointment as per the national ART guidelines, where no punitive action should be taken. It is wrong for our clinics to punish uAnele for missing the appointment yakhe. That is not a standard operating procedure of the department. And even Dr. Buthelezi, when we met with him and asked him, Uguti DG, is this right? He said they know nothing about that. That is an arrangement of the facility. Ensure transfer letters are not required for ARV continuation or restart. Any reports where treatment is delayed by requirement of transfer letter should be urgently investigated and disciplinary action taken where appropriate. The Department of Health and Health Systems Trust should implement the 2023 Adherence Club Guidelines and Operating Procedures with fidelity, including ensuring every person starting ART is provided with good quality, fast-track initiation counseling session 1 at ART start and session 2 after 1 month on antiretroviral treatment. Taking first viral load as early as possible to ensure providing earlier adherence intervention, support, and earlier access to longer treatment supply at more convenient locations. Actioning an elevated viral load without delay, including funding and setting up effective abnormal result recall system and providing quality enhanced adherence counseling when appropriate. Actioning a suppressed viral load without delay, focusing on immediate assessment, offer, and enrollment into the repeat prescription collection strategy of choice the month after viral load is taken. All facilities implement 2023 re-engagement algorithm, including appropriately differentiating services for returning people living with HIV. Ensure the Department of Health and district support partner staff provide accurate and easily understandable information on treatment literacy and adherence, and the importance of an undetectable viral load through consultation, counseling, and outreach. Ensure that treatment literacy information is provided at health talks each day at the clinic. Ensure that the Department of Health and district support partner staff explain viral load test result to all people living with HIV properly in a timely manner. Health Systems Trust should ensure that district support partner staff acknowledge that it is normal to miss appointments and or have treatment interruptions. People living with HIV returning to care after a late or missed scheduled visit, silent transfer from another facility, or treatment interruption should be welcomed. Ensure district support partner staff treat people in a dignified and friendly manner and investigate any report of poor attitude raised by Ritshidze and take disciplinary action where appropriate. Support with training and mentoring of Department of Health staff at facility level on the revised 2023 re-engagement clinical and adherence guidelines.
The next group of issues are those affecting key populations. Most key populations are using public health facilities to access health services. So it is important that our clinics and community health centers provide a friendly, respectful, safe, and confidential environment. Yet, despite sensitization training and retraining efforts, disrespect and poor treatment of key population remain a common challenge. Ritshidze data reveals that at public health facilities, only 22% of gay, bisexual, and other men who have sex with men, 22% of people who use drugs, 32% of sex workers, and 27% of trans people reported staff are always friendly and professional. Where the attitudes of clinic staff have become unbearable, some people have stopped going to the facility altogether. Clinical staff were again this year the most commonly reported as being unfriendly and unprofessional by all key population group, followed by security staff. The majority of key population interviewed did not feel safe or comfortable at the facility. In order for key population to access health services, and in particular, key population-specific services, spaces are needed that feel safe, comfortable, and private enough to disclose that you're a member of a key population group without the fear of judgment, abuse, harassment, or even arrest. Disgraceful privacy violations continue to occur that destroy people's right to privacy. 61% of gay, bisexual, and men who have sex with men, 25% of people who use drugs, 42% of sex workers, and 45% of trans people interviewed did not think privacy is well respected at clinics in uMgungundlovu. Shockingly, many people even reported being refused access to services in the last year because of being someone who uses drugs, is a sex worker, or part of the LGBTQIA+ community, including 4% of gay, bisexual, and other men who have sex with men, 32% of people who use drugs, 17% of sex workers, and 9% of trans people that we interviewed. This is unconstitutional and absolutely unacceptable. Where people do continue to suffer the daily indignities of using the public health system, specific services remain unavailable. Ritshidze data reveals that very few sites provide KP-specific services, and when asked what those services are, it becomes clear that there is little available. Key populations can always access basic prevention tools like condoms and especially lubricants. Lubricants were freely available in only one site monitored. When we spoke to key populations themselves, only 45% of gay, bisexual, and other men who have sex with men we interviewed, 13% of people who use drugs, 37% of sex workers, and 25% of trans people using public healthcare facilities said they could access lubricant. Not all facilities prioritize offering key populations PrEP, despite it being available in 100% of facilities monitored by Ritshidze. While covering a wider and differing set of sites, only 4% of gay, bisexual, and other men who have sex with men, 1% of people who use drugs, 9% of sex workers, and 0% of trans people interviewed reported being offered PrEP at the facility. This points to the reality that while PrEP is sitting in facilities, key populations are not always being made aware or actually offered PrEP. The majority of people could access the contraceptives they wanted, but at times, key population are refused access to contraceptives specifically because they are a member of a key population group, as reported by 40% of people who use drugs, 25% of sex workers, and 33% of trans people we interviewed. South Africa faces a well-documented epidemic of gender-based violence, including homophobic and transphobic attacks on the LGBTQIA+ community members. Sex workers also face extreme levels of violence and forced sex at the hands of clients, partners, and even police. It is critical that key population who face sexual violence feel safe enough to access the necessary services at the clinic. However, only 30% of gay, bisexual, and other men who have sex with men, 36% of sex workers, and 45% of trans people thought that staff were well trained to care for those who have experienced violence. Too few people who wanted to access STI screening and treatment were able to at the facility. Where they could, we still hear of reports of key population being discriminated against or staff acting in a hostile manner to those trying to access these services. Harm reduction services remain out of reach to people who use drugs. Only 2% of people had been given information about where to get new needles. Only 14% of people had been given information on where to get methadone, and only 17% were able to access drug dependency support. Gender-affirming services are critical. Yet, only 27% of trans people say the facility staff are always respectful of their gender identity. 33% said that healthcare providers use their wrong names, and 67% said they use their wrong pronouns. 73% of trans people we spoke to wanted to access hormone therapy at public health facilities, and most clinics were unable to even provide information to trans people about where to find them. We now move to recorded stories.
Kune story lana engithanda ukushare esingasange singiphathe kahle esenzeke this year January. Okay, mina ngumuntu odla amaphilisi ARVs. I'm transgender and I'm also HIV positive. So amaphilisi ami ngiwalanda eNothdale Clinic khona la uMgungundlovu. Ngelinye ilanga kwakuyi date yami yokulanda ama-ARVs ami. Ngakhohlwa ngadlula u2 days ngingazange ngiwalande. So ngathi mengichecka ikhadi lami ngabona ukuthi hayibo sengidlule u2 days ngingazange ngiwalande amaphilisi. Then I got up in the morning and went to the clinic la ngilanda khona amaphilisi. Ngafika ekliniki ngabeka ikhadi lami as usual because mofika khona ushiya ikhadi ngaphakathi ekliniki. Hayi ngaqhubeka ngame queue. Ngathi ngisame iqueue kwaphuma usister ephethe ifile yami. Ifile yami yayipink, which was wrong ngoba lapha yana amafile ahlukaniswa ukuthi laba they are positive, laba ba negative. So if I me pink, it means you are positive. Kukona lokho nje kukodwa ku wrong. Then waphuma usister ephethe ikhadi lami. Wasay you wena mahosha ngingile engibiza ngawo wonke amagama. Why ufika late? Why uqale clinic eyakho? Because this is not your mother's house. Ngakhala khona ulayini. Ngathi mengikhala wathetha wathi ukhalelani vele ninelala namadoda abantu nenza kanje ngicaze neclinic yenu. Babizwa abantu bathola amaphilisi abo baphuma bahamba. Then kwaqhubeka kwabizwa abanye emva kwami. Ngaze ngathi mina hawu sister mina ngibizwa nini? Kwaphela ngifike before these people asebehamba. Wathi nelo imsebenzi yokuba umahosha. So uzohlala lapho. Ngahlala lapho. Ngahlala lapho. Kwaze kwavala iclinic. And I ended up not getting the medication. Ngisizakalanga. Ngaze ngaya kwenye iclinic ngaqala phansi bathola amaphilisi kabusha. Kwi-mobile clinic. Njalo bengicabanga lento le. Angifuna ukuphindela kwi-public hospital. Ngenxa ye-Nothdale hospital intensive kakhulu. Ngavele ngayeka ngaya kwi-mobile clinic ngaqala kabusha amaphilisi. Kwi-mobile clinic ungcono ngoba if umise i-date bakufonela and then they bring you your medication. Kanti kwi-public sometimes you don't have money to go there, so you'll have to walk. That's why abantu abaningi they end up defaulting. Bengingazitholi at all kwi-public. Into ebengiyithola bekwama-condom and sometimes bengifika khona they were out of stock. Into engathanda yenzeke kuma-public hospitals for abantu abafana nathi ukuthi mhlambe kube ne-section yabo like babe nodokotela wabo kube ne-hormonal therapy yabo abazokwazi ukuthola khona uncedo.
Ngahlangabezana nenkinga eMbalenhle Clinic. So ngahamba ngaya khona ukuyothola i-access yakhona. Then bengiyakhona ngahlala the whole day until kwavalwa then ngathola unesi wakhona, then esizohamba, then ngathi bengihlala the whole day. I don't remember her name. Then ngimbuza ukuthi ngoba ngihlala isikhathi eside kangaka, ngenze njani, ngibuye nini. Then wathi sebesikhathi sokuhamba, then bona sebasenaso isikhathi sokulala, sokungi-assessa. Then ngaphatheka kabi because mina ngumuntu onenhliziyo encane, angikhulumi kakhulu. So ngaphatheka kabi, then ngahamba, ngabuya next time. Then the same thing, then ngabuyela ke elona kaze ngagcina ngizame ukuthi ngiye eDindele Hospital. Then they told me about Ritshidze Youth Clinic. Lapho ngathola elona if i-access yakhona ngoba iyona la basiza khona ilona ingane izilona iziphila HIV and yonke isifo abanaso. Then ilapho ngaqala khona ngathola i-access yakhona, i-counselor, nodokotela and psychologist. Then ngakwazi uku-accessa ama-ARVs, medication. Then Imbalenhle not assess me kakhulu because that's why angithandi imbalenhle because i-system yakhona uhlala usuku lonke abakuniki assess. A lot of people that complaining nge-system yakhona. That's why manje ngihamba eDindele Hospital because i-access yakhona ngiyayithola ngale ndlela engidinga ngayo. Angihlali isikhathi eside futhi angihlali isikhathi eside kuze kushaye u-2-3 ngihlala nje lo ma-minutes ambala or hours then ngibe sengiyahamba because i-system eseDindele Hospital iyashesha futhi iyasizana. I'm a trans, being trans it's been 8 years. Imbalenhle ngithola access izinto ade ngiyidinga iloku condoms nawo manye ama-access ade ngiwadinga. Then eDindele Hospital I get access yakhona. They know me, they know who I am, ngiphila nhloboni. Then iloop if ngithola if ngidinga ama condom loop and if I need more medication for ukuzivikela nayo yonke into engiyidingayo then ngiyathola eDindele Hospital. Ilapha la ngidinga khona access eningi sengiyithola khona. Imbalenhle i-improvement engathanda ukuyibona ukuthi abantu bengalindi isikhathi eside, i-youth bathole access abantu abaningi abayidingayo. I-system yakhona kumele ibe khona ibe fast the way amanye ama-facilities la ashesha khona. Ngahlangabezana nenkinga eMbalenhle Clinic, so ngahamba ngaya khona ukuyothola i-access yakhona. Then bengiyakhona ngahlala the whole day until kwavalwa. Then ngathola unesi wakhona, then esizohamba. Then ngathi bengihlala the whole day. I don't remember her name. Then ngimbuza ukuthi ngoba ngihlala isikhathi eside kangaka, ngenze njani, ngibuye nini. Then wathi then lapho ngathola ilona if i-access yakhona ngoba iyona la basiza khona ilona ingane izilona iziphila HIV and yonke isifo abanaso. Then ilapho ngaqala khona ngathola i-access yakhona, i-counselor, nodokotela and psychologist. Then ngakwazi uku-accessa ama-ARVs, medication. Then Imbalenhle not assist me kakhulu, because that's why angithandi imbaleki, because i-system yakhona uhlala usuku lonke abakuniki assist. A lot of people that complaining the system yakhona. That's why manje ngihamba idindile hospital, because i-access yakhona ngiyayithola ngale ndlela engidingayo, angihlali isikhathi eside futhi angihlali isikhathi eside kuze kushaye u-2-3 hours.
Drug addicts kahle kahle, so bengingakwazi ukuthi ngimanage isikhathi sokuthi ngiye eklinikhi because benginenkinga yama-drugs kodwa bengiyithatha i-treatment ngaso sonke isikhathi. Indlela akade bengitreat-a ngayo
Sicela uxolo nje ngalo qeda ukwenzeka.
Sanibonani. Clinic engisebenzayo i-street ngomuntu positive, ngi-sex worker. Ziningi izinto esihlangabezana nabo njengoba samantombazana ama-sex worker si-positive.
I'm an HIV positive sex worker who uses the East Boom Clinic. There are a lot of things that we come across as female sex workers when we go to the facility.
Kwesinye isikhathi uyafika ngatransferla khona kusuka from Greytown.
I was transferred to the facility from Greytown.
Yeah, and ngaba nenkinga kushuthi la hlala khona njengoba samantombazana ama-sex worker. Ngaba nenkinga kushuthi siyantshontshela ama-treatment wethu. Emva kwalokho mangabe ntshontshe uhambe uthi uyocela usizo uchaze nangenkinga yakho bakuchike bakudelele. Emva kwalokho mangabe siba nenkinga nje nangukuthi siba nanezifo ke nje ezincane lezi eziba nje kuthina amantombazana ama-sex worker.
I had a problem because due to my living arrangements, it sometimes happens that we steal ARVs from each other. And when you go to the clinic and explain that your ARVs have been stolen, they scold at you and not want to help you. And also when we are presenting with STIs as sex workers at the facility, we experience a lot of challenges.
Lapho uyakushawota phambi kwabantu akakhona ukuthi akhulume nawe eceleni, uyakushawota akubize mahosha zokume kancane amakhondom anwazini yindaba ukuthi njalo ufuna sihlale attendana nani ninamantombazana la ku-street.
When you present with an STI at the facility, they degrade you and refer to you as a prostitute instead of respecting you as a sex worker, saying you should learn how to use condoms as sex workers because they cannot keep on assisting you with one and the same thing, which are the sexually transmitted infections.
Njengokuthi ngingumuntu one-depression, mhlawumbe uthola ukuthi ngize ngiyaduba ngiyaphuma ngiyahamba ngokuthi ngalimala kancane because nemoto ngiphume ngihamba. So mangabe sengibuya ngize ngibhodle ngoba bona bangi-understand ukuthi ngumuntu kanjani. Mase ngibhodla ngiyabuya bangitshela ukuthi indaba yami ngeke beze bekhona ukungisiza, mhlawumbe boze bengisize ngo-6 noma ngo-7 ebusuku kulong ngifike ekuseni, mhlawumbe ngabo-4 noma ngabo-5 intatha kusa. Kodwa uthola ukuthi futhi boze bengisize ngabo-7 ntambama bengangisizi. Balowo bebhizi bangithuka besho yonke into.
When things like this happen, I choose to leave the facility and sometimes disengage from care until I'm able to calm myself down. When I do eventually come back to the facility, they tell me that they're going to see me last. And you find that I arrive at the facility around 5 a.m., but only get seen or assisted between 6 and 7 p.m.
Kuleso sikhathi bakutshela ukuthi u-defaulting bakubuza ukuthi amaphilisi wadla kanjani and uyamtshela umuntu wakhona ukuthi hayi amaphilisi kwesinye isikhathi ngeke ngikhona ukudla amaphilisi ngingadlanga ngoba mawukuthi angikho right ngiyothola ukuthi ngiyalala lapha kuleso sikhathi ukudla nginakho endlini funa ukuthi ngize ngivuke noma ngakuthiwa ngiyagula ngihambe ngoyizama lo mali.
When they ask questions about my treatment adherence and I try to explain my situation, where sometimes I go to bed without eating and I'm forced to either go try hustle the money by doing the work that I do, they don't want to understand us and they don't want to pay attention to us. I'm also a person who suffers from depression, so I usually just choose to take time off to cool off before attending to issues.
Ngize ngashiya manje ngisebenzisa imobile kwemobile bayakhona ukungiunderstanda bayakwazi ukuthi bengimukele kodwa ke nokunye bayazama ukungisiza mabengakwazi maningakwazi ukuthi nisize ngo-street uhlukumeza kakhulu amantombazana angakhona ande angazi ukuthi singenza kanjani ngoba masinenkinga thina basizi ngokuthi ngoba nakho sithengisa ngemzimba.
I wish that we could get assisted with the East Boom Clinic because when we present with any health-related issues as sex workers, we are not assisted at that facility. I eventually left the facility, moved into a mobile clinic where I'm assisted well. They try the best that they can do.
Sanibona. Yebo nami ngisebenzisa uS Boom so ngo-October ngangingazizwa kahle so I decided ukuthi ngiye kuS Boom ngiyowenza i-check up because ngangingayi endaweni yamantombazana.
I also used the East Boom Clinic and in October I decided to go to the clinic because I was not properly going on my periods.
So mengifika ke bafike bangicheck bathola ukuthi ngikhulelwe ngempela bangicheck nje yonke into bathola futhi nokuthi ngi-HIV positive bangithatha amagazi banginikeza namaphilisi so bathe ngobuya ngoNovember 4.
This is where I was diagnosed with HIV. I was also given a pregnancy test that came back as positive. They took blood and asked me to come back in November.
So mengifika ke ngingafiki ngoNovember 4 get 2 days I think umhla ka6 mengekho mistaken ngifika ke bathi laba bethathe khona amagazi wami ila angazi noma iwona lahlekile something like that lahlekile fanele ngiqala phansi ngibuye yabo bangithethisa ukuthi indaba ngivele ngizofika i-daytime isidlulile ngasho ukuthi bengingekho ngakhona lapha ya.
I missed the appointment date. I was supposed to go on to the facility on the 2nd of November, but I went on the 4th of November. When I arrived, they told me that my results had been lost. I'm not sure if they had lost the blood samples or the results, but they were scolding me, asking me why I was late for the appointment.
So vele ke lapha kuS Boom ngoba sishilo usli uma nje vele uyintombazane nje enza lo msebenzi lo bathatha advantage yalokho bayakuthethisa and wonke umuntu oseclinic ongazi ukuthi wena uzengani la egcineni uzowazi phela since bona bekuthethisa and ngalokho wena uzophindela kanjani eclinic uphinde uyolanda amaphilisi ngoba vele wena wonke umhlaba useyazi since ngangumuntu futhi wayiqala nokwazi kavele ngabona ngiphatheka kabuhlungu nje ukuthi ngizowenza njani obviously ngizo default. Then after that, bathi angobuye go.
This was the very first time that I had realized that I was HIV positive. This was the very first time that I was diagnosed. So I wasn't familiar with how things are supposed to be. But the challenge with the East Boom Clinic is that whenever you come to the facility to consult for whatever health-related issue, everybody in the waiting area is going to know because they scold you publicly and disclosing your status and disclosing the type of work that you do because I am also a sex worker and now even people that didn't know the type of work that you do have privilege to knowing that information because of the nurses that scold us publicly.
And okunye obathi ngobuya ke ngoDecember nganginikeza amaphilisi ngoNovember because ngiqhubhe idate bathi ngobuya ngoDecember I think December 2 or 4 lapho so ngizophuzana manje ngizobe ngiphuzana obviously babe ngineza amaphilisi enyanga ngoba ngineza ngoOctober bathi ngobuya ngoNovember.
They gave me 1 month supply worth of treatment in October, asking me to come back in November. So because I missed the date with 2 days in November, they didn't give me any treatment. They gave me a return date saying I must come back on the 2nd of December. What am I supposed to be taking in the meantime? I think it's important for everybody to note that the lady is currently pregnant.
Before siye kowesi-2 ndanicela baphathi, today usisi must get a treatment today, because this is unfair. And sitting here, I cannot keep on smiling, listening to the gross violation of human rights. Can we please assist to Sisi? And if it means there must be punitive measures against the nurses who denied her a right to life, let it be. Because if we are unable to do that, Mzam, you need to make follow-up on that. Because if that matter is not resolved, I am going to take it upon my hands, report it with Office of Health Ombudsman to be investigated, and we must take legal steps about that. If it means we must report this matter to Section 27 or any law firm to sue that nurse, let it be. I cannot sit here and listen to people whose rights are denied by other people as if they own these facilities. We cannot. I cannot. These are the things that makes us angry. These are the things that makes us to break the law. And I am not in a position to give instruction to people to go and occupy these clinics that ill-treat people. But at some point, I will run out of patience, and we will end up doing that. We must make sure that tomorrow morning, some phonela and find out ukuthi ulthole na usizo, because these meetings is not as Kulume or UJJ Tabane. We are here to resolve problems of the people. Thank you.
Sanbon, mina igama lami nguthiwa wakaMadlala, ngihlala eMbali, and the clinic that I use, Imbalenhle Clinic, I'm just going to encapsulate my story in one word, of which being misgendered in public hospitals, more especially Imbalenhle. So,
Try to bring it closer.
okay, so with that being said, okay, mina igama lami nguthiwa wakaMadlala, ngihlala eMbali, and the clinic that I use is Imbalenhle Clinic. And my story, I'm going to encapsulate it into one word, which is being misgendered in public hospitals, in public clinics, more especially in Imbalenhle. So as a transgender person, I take hormones, which is the pills that make you a bit feminine and everything. So there's complications are involved with taking hormones. So going to a clinic for me, one thing, bangithi misgendered, vele, by the time I get there, I need to register by the reception. And the card that I'll get there is 2 different cards. There's a blue card for the males and the pink card for the females. I personally, as a transgender person, identify as a female. So I need to get treatment for the female just because I see myself as a female, in as much as my sex, my genitals, and my gender, which is the identity in the mind, doesn't correlate bokanjalo.
Mina ngumuntu osebenzisa Imbalenhle Clinic, ngiumuntu o-considera as a transgender. Transgender umuntu obelethelwe emzimbeni thizeni kodwa angazizwa angumuntu loyo, azizwa awumuntu wobulili obunye. For an example, uzizwa awumuntu wesifazane in as much as umzimba uthi umuntu wesilisa. Into yokuqala nje engamphathi kahle maka eclinic kusekuthenini abantu besilisa bathola amakhadi ablue, abantu besifazane bathola amakhadi apink. Yena njengomuntu ozibona angumuntu wesifazane ufisa ukuthi eclinic bangamnikeza ikhadi leli eliblue, elipink, elisho ukuthi intombazana, bangamnikeza lekhadi eliblue ngoba nabamnikeza ikhadi leli eliblue kusho ukuthi bayamqwaya ngobulili lobu yena angubo.
And to that point, it got to the point whereby now, that card. Now I need to submit it back for them to approve and everything. So my pronoun that they will use is he. Meanwhile, I identify as her and she. So now, my privacy, you are disclosing a sexual identity without me consenting to, and you're putting my life in risk.
Enye into basuke bayenze ukuthi nababuyisa ikhadi ke ngoba ngisho uyaligqwalisa ulohambise bese baphinde balibuyise kuwe bakhuluma kimi njengomuntu omfana kanti niyabona nani ukuthi ngendlela engibukeka ngayo ngomuntu wesifazane ngifila ukuthi nabenza into efana naleyo bangifaka engcupheni ngoba kunabanye abantu mhlawumbe bangathanda abantu abafana nathi abangasuke bangenze ingozi.
And now we're moving to the doctor's side whereby I need to get that help just because I'm here for the after effects of the hormones learn, which was excruciating headaches and non-stop nausea. So I get there by the doctor. Meanwhile, good doctor can see with the breast developing and everything. Mind you, as a doctor, I feel like you should maintain that doctor and patient confidentiality. Meanwhile, you're not doing that. What's really going on here.
So mawufika udokotela naye uyachubeka futhi ekuhlukumeza in the sense yokuthi uthi maka kubona ukuthi unamabele angithi ngize clinic ngizothatha amapilisi okushintsha ubulili noma amapilisi okungisiza ukuthi ngibe yilobulili mina engizazi ngingibo. Dokotela maka kubona ukuthi unamabele kodwa ifile liblue kunokuthi aziphathe kahle asebenze njengodokotela ubiza unesi omunye ukuthi azombonisa mhlambe sengathi umhlolo lento oze ngayo.
On that day, it got to the point whereby even the securities at my house on that clinic in Balendle, corner the securities by the gates, but my house, everything is just going according to place. All of them were called into one room for me to strip naked for them so they can confirm that I'm really a boy per se.
Kuze kwafika esimeni sokuthi kuze kubizwe nama security kunalama security asebenza gate phinde kube nama security asebenza ngaphakathi eclinic ukusiza abantu kuma line. Kugcine kubizwa ngisho no security ukuthi bazongena ekamereni elilodwa nami noma egumbini elilodwa nami kuthiwe mangikhumule babone ukuthi vele ngingumfana njengoba ikhadi lithi ngumfana kodwa nabangibukile babone intombazana.
Sanibona. Igama lami nguNonkululeko wakwaZuma. Ngihlala ke street. Ikliniki engisebenzisayo street. So ngahamba ngaye ekliniki ngadlula idate. Mangihamba ngakusasa ngekliniki hlangana nonesi. Mayebona ikhadi lami uthi bekufanele ukuthi ngifike ngayizolo sengifika namhlanje. Sengifika namhlanje mase evesane eyangishawa ukugcwela abantu asibuka nje lamaphara lawa libele ukuhamba ebhemana namawulu yabo angishawa phambi kwabantu.
I am a person that uses drugs and used the East Boom Clinic. I missed an appointment to go to the facility by a day, and on the next day when I went to the facility, the nurse was rude, scolding me and shouting, calling me a drug user in front of other people.
Yebo mase engakunikeze athi angibuye ngakusasa mase sekuphelile lento engibhemile. Washo ukuthi khona into engibhemile ama drug lawo engwadlayo. Amaphilisi ngangawathola wangibuyisela emumva endlini. HIV.
So the nurse denied giving me my ARVs on the day, saying I should go sober up and come back the following day to collect the ARVs because I admit that I had taken something on the day before going to the facility.
Sorry. Kunomsindo kula kona, can we be quiet please? Thank you.
Sanibona. Igama lami ngubongiwe ngwashezi ngihlala e-street. Shuthi ngiqala ukudla amaphilisi bekade ngihlala estradini ngibhema ihungu. Shuthi ngaye eclinic bengifike eclinic benga-street nje kahle besitshela abasithunywa ngibona usidla ama-drugs.
When I was initiated on ARVs, I was living on the street and was addicted to hunga at that time, which is a type of drug. We were mistreated whenever we went to the facility. The nurses would tell us how they were not the ones that have sent us or taught us to use the drugs that we were now dependent on.
Shuthi umbuzo engayibuza wona ngaleso sikhathi ukuthi kanti bona basebenza abantu abanjani basebenza abantu abangadla ama drugs noma basebenza abantu abaclean noma abangcolile kanjani mina ngase clinic ngena wonke umuntu ngangayitshela ukuthi kuyakhetha umuntu ongenayo.
A question came to me to say, whom must go to the clinic. I asked myself if the clinic was servicing people that were clean, people that had taken a bath, people that were addicted or not addicted. This just made me ask myself a lot of questions relating to what type of person is supposed to go to the clinic, because according to the knowledge that I had, anybody was supposed to go to the clinic and access healthcare services as they desired.
Ngoba futhi kuyenzeka kwesinye isikhathi uthi siyawabhema ama-drugs kodwa sithandi siney'nkinga ezingafani akangazi ukuthi njengoba ngidla ama-drugs ngihlala estradini kuyini indaba futhi akufuni yena vele lokho kodwa akakwazi yena lokho ukuthi kubangwa yini imbangela yalokho.
They don't know the circumstances that force us to live on the street or use the drugs that we do choose to use. They also shouldn't be worried about that because they have nothing to do with our reasons and our private lives, but they need to be providing the service that we had come to access at the facility.
Shuthi ngagcina sengidefaulta ngaleso sikhathi kwakhona abantu abaqhamukayo aba-like immobile ekuthiwa inkunzi yasematholeni ngoba ngadefaulta ngawayeka amaphilisi ngagcina sengigula ngingabi right kwaqhamuka leyo mobile ekuthiwa inkunzi yasematholeni ekuyiyona ekwaziyo ukuthi sisize isupport ngayo yonke indlela ngayo yonke yonke umuntu osestradini usupportwa yiyona ngoba eklinika asilutho sifana nenja.
I'm so sorry. I disengaged from care until I fell sick, and when I was sick, I was advised by a friend to go to Inkunzi Amatole Mobile Clinic, where they assist us with everything that we need. They actually help people that are homeless and people that are living on the streets, different types of people, because now we are unable to go to the clinic because when we go to the clinics, we are treated like dogs instead of like human beings.
Engicelayo nje ukuthi ngelinye ilanga ngicela nasibasazi ukuthi sizabantu siyafana nabo bonke abantu esikwenzayo nathi asikuthandi sinezizathu ezingafuni bona kodwa nathi sizabantu. Ngiyabonga.
I would really appreciate it if the clinics were to start treating us like human beings, because the lifestyles that we're leading are not by choice. The circumstances that are forcing us into those lifestyles for which we don't owe anybody an explanation about.
Asibingelele ntambama. Kunesimo esinzima ngidla amaphilisi egciwane lengculazi lawo ekuthiwa ayaphilisa ngoba ngiphilisile ngempela bese kuba khona ke sinye isimo futhi abantu ngobude bendlela abangena kusona ukuthi agcine ngene kwezinye idakamizwa ezihlukahlukene amaphilisi aphilisayo kanye nayonga.
I am a person living with HIV on ARVs. I'm also a person that uses drugs because of circumstances that I cannot divulge. I was told that ARVs give life, and I can attest to the fact that ARVs have saved my life.
Okubuhlungu kakhulu ke siba namagama esibizwa ngawo singaqanjwanga ngawo abazali bethu basibize ngamaphara. Lawo mapasa awekho emapasini ethu. Sesiyawa enjoya ngoba vele iwona esiphila ngawo noma kungafanele.
They refer to us as the druggies, which are names that are not our given names by our parents. These are not names that are in our IDs, but we don't have a choice but to accept the situation.
Engangoba ukuthi kwesinye isikhathi ngangaya eclinic ngiyolanda itreatment yami. Ngokukhona umsebenzi engangiyowenza ngangixathukile. Because ngathi ngifike eclinic kwathiwa amaphara wangeni ngendlela engangicathuke ngayo ke abafuthi abaningi baya understand ukuthi most abantu ababizwa ngamaphara abahlala emgaqweni and futhi abazwana abanye namanzi noma kunzima ukuthi bathola amanzi.
I had disengaged from care because of the treatment that I was receiving at the facility, being referred to as a druggie. Most of us understand that people that live on the street, people that are homeless, do not have access to bathing or water, sometimes no access to soap. So people that have had this experience understand exactly what I mean when I say we were referred to as druggies in the facility.
Engangoba ukuthi ngathi mangifika eclinic ngixoshwa kwangiphatha kabuhlungu engangoba ukuthi ngabuyele mu treatment engayitholanga ngesimo sokuthi angiyena umuntu okuthanda ukukhoza umsindo hayi ngoba mhlambe ngangibasaba ngawazi amalungelo ami ngabuthwa kathi esingakhuliswa ngazi konke ngempilo yomuntu nangamalungelo omuntu nangamalungelo esiguli kodwa ngathi nje angeke ngibahloniphe.
When I was turned away from the clinic, I chose peace. I decided to live gracefully because I, as a person that was or is a member of the Treatment Action Campaign. I'm very much aware of my rights as a patient and my responsibilities also as a patient. But at that point in time, and also looking at my circumstance, I decided to just leave the facility without accessing my treatment.
Ngabuya ke ngakusasa ngeshwa ngangayigqokanga isuti kodwa ngangizongile ngimuhle ngoba abaningi bayazi ukuthi ukotini angudli ngivungula ngawo.
I went back the following day. I was not wearing a suit, but had put I was best dressed according to myself, and I was very clean and neat, ready to be able to access the treatment.
Ngixolele clinic engikhuluma ngale clinic langa lakithi impopomeni clinic.
The clinic
lengaziwa kuyona futhi engigijime kakhulu kuyona engike ngasebenza na kuyona ekubeni kube advisory board yakhona kodwa mhla ngiyiphara bacabanganga ukuthi ngangumsizi wabo ngelinye ilanga.
Oh, wow. The clinic that I'm referring to is Impopomeni Clinic, which is a clinic that I was once a board member of. And when now I had this challenge or this addiction that I was going through of being addicted to wunga, they forgot the fact that I was once a member that was working with the facility.
So ngenhlanhla I get insight and ngayithola treatment yami ngaphuma ngeshwa ke unesi owayengitreate ngendlela nama security ayengitreate ngayo babengekho khona eclinic ngoba ngangithi ngenzela bona.
On the second day when I had worn my best clothes, the nurse that mistreated me on the previous day and the securities that also mistreated me the previous day were not there. This to me was very disappointing because I had taken a bath especially to show them that I am capable.
And ngaxoxa ke nomphathi umphathi kwamphatha kabuhlungu because he knows me ukuthi besebenza naye. But inkinga enkulu ke mina ebengifisa ukudlula kuyona akumina ngedwa. Engangubu abanye babafowethu bagcina bentshontsha amaphilisi and abanye bagcina bewacosha emgaqweni ngoba abanye bayawalahla. Nami khona kwesinye isikhathi la ngawathatha khona nje emgaqweni ngawabeka ekhaya ngiyawasebenzisa ngamaphilisi extra mhlambe ngamakuvukisa amabili ngoba ngawacosha emgaqweni.
One thing that hurts me specifically is the fact that some of people that use drugs like I do cannot access the treatment, so they end up stealing it or get it or collect it from garbage bins. Because for an example, there's people that collect their treatment and throw it out. So that is where we get the treatment. For an example, I currently have 2 months worth of treatment that I have collected from a garbage or waste bin.
Mase futhi mhlawumbe okunye esifisa ukusho ngoba nabo abaphathi bakhona. Siyajabula abaphathi ukuthi nibe kanye nathi ukuzozwa inkinga esinazo. Siyacela ukuthi niwavumele amaphara angene eclinic. Kodwa mase niyawasesha ngoba phela ke kube ngathi azoganga kanti amanye asuke ne concern ngempilo because ngiyiphara kodwa ngine concern ngempilo. Mase kube ukuthi okunye ke sesiluzwe abafowethu abaningi empopomeni be default hayi ngoba kukuthini amaphilisi abawathole and abanayo indawo la bengawathola khona amaphilisi.
Now that there are representatives of the Department of Health, I would like to plead with you as leaders to please allow people that use drugs to access healthcare services at the facilities. They'd rather be searched to ensure that they're not there to steal anything from anyone, but they're worried about their lives. For an example, I, as a person that uses drugs, am worried about my life, hence I go to the clinic to access services. There are a lot of people that we live with in the streets that have lost their lives. Some of them have disengaged from care because of not having access into the facilities. It's not because they did not care about their lives.
Yeah, anginawo amaningi bekukudlulisa lokho ukuthi siyacela ukuthi bandla sivunyelwe eclinic sikwazi ukungena sithole medication yethu ngoba ama programs amaningi athatha abantu abanjengathi abavalele ngaphandle. So umphakathi nathi kuningi engakuthola kuthina futhi mangicabanga abantu abaningi benu la ingadi abanye bazenzelwa amaphara mase bawapha imali encane. So siyacela ukuthi nisazi njoba nasinakekela ngiyabonga.
I would like to ask again that people that use drugs be allowed into facilities because as community members, we are assisting each other. Most of us people that use drugs help fix people's gardens in the community. So can we please be also considered when we go to the clinic as people that deserve to be given the healthcare services that we require?
Thank you. We are going to recommendations. You know, just a public disclaimer. I am a product of the apartheid regime. I was born in that time. And I'm glad that I contributed in making sure that we overthrow the apartheid regime. I used to think the apartheid regime and the white privilege, then, stand. All these people who are talking here, none of them who are accessing health services with facilities that are managed by white people. All these facilities are managed by black people who oppress the other black people, who ill-treat the other black people. And you come here and you are expected to smile and laugh when you hear all these sad stories. It is a pain and a shame on a government of black people that continuously claim to serve the interest of the people, yet they are the ones who are killing us. Stigma and discrimination against sex workers, people who are using drugs, gays, lesbians, transgender, you name them all. I cannot sit here and take it as normal when people are asking for favors. Comrades, we must not ask for favor. If they are calling us amapara, we must not hear and beg for what is ours. No nurse out of these managers and those at facility level owns these clinics. None of them that takes money out of their pockets to buy medicines. These medicines, I am a taxpayer in this country. And some of us here, all of us, if I'm not mistaken, we are contributing towards the tax. If you go and buy water and buy anything, there is VAT there. It therefore means whether you are employed or unemployed, you are a contributor towards the tax. It can be true that certain individuals, because of positions that are given to them, it's high time now that Mzamo, you need to convene a meeting with MEC and the HOD so that we can discuss with them how do we address these issues. Because we used to toy and we were accused, we were called names. We are trying to be civil, but what I hear here in this room is worse than before. Because there are some nurses who think that they own our health establishments. There is this issue about Mbalenhle Clinic. Since I'm sitting here, Mbalenhle Clinic this, Mbalenhle Clinic that, and it does not sit well with me. You need Mzamo and the Ritshidze comrades to go and visit Mbalenhle Clinic, meet with facility managers of Mbalenhle Clinic, and present all these issues. You need Mzamo with the comrades of Ritshidze and the Pillar organizations to convene a meeting with the district director or district manager was uMgungundlovu. We cannot accept this. We cannot, because we need to know if they are aware of these things, what is it that they are doing to turn around the situation. Many people who are here are the same people our Department of Health is coming with plans to go and look for them and re-engage them. They are here. They are here. They are not anywhere. They are here. And they are here to explain why they decide to disengage. And the government is going to spend a lot of money to hire consultants to come with a turnaround strategy. Turnaround strategy, it is the attitude of mind from our healthcare workers. Their negative attitude, their bad attitude towards the community is what makes people to stop going to clinics. Nothing else. And if the managers of these facilities are not telling their staff, one day community members will tell these staff members in a language that they might not like it. Because personally, as Anele, I give you back what you're giving to me. I don't care who you are. Whether you are President Ramaphosa, Jacob Zuma, I care less. I only fear God. And I won't come here and say to the community, if they shout at you, shout back. But me, as Anele Yao, I fear for God, I only fear God. Because I know my rights. And Mina, I am not scared of it, drama. I like it, drama. If you give me drama, I give you movie. I give you movie. But one thing that I know, I am the one who's going to win. I am the one who's going to win. So we need to address this. The other issue is around this East Boom Clinic. The East Boom Clinic is one of the 100 facilities that are not doing well on retention to care and adherence. 2, it is one of the clinics that have been identified by PEPFAR, the National Department of Health, as centers of excellence for key populations. I think we need to convene a meeting with Dr. Moerane from the National Department of Health, PEPFAR and UNAIDS, and ask them what is excellent by the East Boom Clinic if we've got a rotten staff that ill-treats the people. The center can be a center of excellence, but the people inside the center makes the center not to be a center of excellence. And if it means that PEPFAR must take its money from that particular East Boom Clinic and invest it somewhere, let it be. Because we cannot have a situation where people from key population go to this clinic to get services and then they are ill-treated. We cannot. Something must happen. Heads must roll. There must be consequence management, because I cannot sit here and listen people explaining why they have opted to die in silence, yet there is help. And these people who are ill-treating us, they don't use our clinics, they use private health establishments. No, this is not on. Something must be done. Something must be done as a matter of urgency. Mzamo, on the 1st of December, we fought for KZN to host the World AIDS Day. Isabella Elembe, the deputy president, will be there, the minister will be there. I told them that the premier and the MEC must be there as well. On the 30th, we've got a district accountability meeting between the community and politicians. It was going to be a meeting like this. I so wish it, because we are expected to bring 300 people in that meeting. I so wish that we identify all these people who've got serious problems and frustration, so that we can go to the politicians and tell them what we're going through. Guys, 18 and 19, we are registered for elections. 2024, we're going to vote. How do we use our power? The power lies with us as the people. It lies with us. If we don't go and vote, we won't have a government in this country. How do we use our power to change our living conditions on the ground? It must not be like someone did us a favor. Nobody did a favor for us here. We need to continue to fight. But also the question that I have, what are TAC, NAPWA, and other organizations of people living with HIV doing on the ground? Because this report was collected between July and August. We are in November now. It's not wrong. But from where I'm seated, I think there are cases which needs urgent intervention. How do we make sure that our branches are visible at community and at clinic level, so that if Utiwa today, because if Usisi Loyano treatment, she was from my community. This is our born. Maybe that thing was gonna be on TV now, exposing that facility. Because we must speak their language they understand better, in order for them to understand that we've got the rights in this country. The Constitution is protecting our rights as well as its dignity. Who is a nurse, after all, to tell me that he or she is not going to give me treatment, I must go and wash? Therefore, it means we must advocate for our clinics to have showers. So that if she says I must go and wash, and she tells me go to that bathroom and take a shower, Because we know the levels of poverty that we are exposed to in this country, more especially as black people. That's why I cannot accept a situation where a woman is ridiculing another woman for being a sex worker, as if they do not understand and know the conditions that we live in. That is worse than the apartheid government. And Tina bantu abamnyama, if we continue to accept this, it is going to continue to happen like that. We must stand up and fight back. But when we're fighting back, we must not ban our clinics. We must not disrupt services. Let us name and shame these rotten potatoes within the system so that the system can get rid of them. There are a lot of graduates outside there who are unemployed, who are keen and willing to serve the people. Those who are tired of serving us, they must go and get the young blood that will understand our plight as the black people. We cannot accept this. I cannot accept this. The recommendations are as follows. Ensure that all clinical and non-clinical staff, including security guards and cleaners across public health facilities, are sensitized on provision of key population-friendly services to ensure a welcoming and a safe environment for all key populations at all times. Key populations must be involved in the implementation of these training modules. Any reports of poor staff attitude, privacy violation, verbal or physical abuse or harassment and or of services being restricted or refused should be urgently investigated and reported. The Department of Health and PEPFA should expand centers of excellence. And there is this East Boom Clinic, which is a center of excellence, but it does not serve the people. If we will continue to have nurses like the one who refused to make sister and Amanyama Kaban, therefore it means either East Boom Clinic is being changed from being a center of excellence, or those people who are working there, we name and shame them and demand that they are dismissed from work. Expand the centers of excellence model to ensure that at least 2 public health facilities per population in uMgungundlovu serves as a key population designated service delivery centers. A minimum package of services should be made available at these facilities as outlined in the State of Health report. Easy referral and adequate resources, including transport or money for transport, must be provided for people to take up these services. PEPFAR must support these facilities with additional key population-friendly staff and resources to provide comprehensive health services to the specific key populations being served. Ensure that HIV prevention tools, including lubricants, external and internal condoms, PrEP and PEP, are made easily available at all public health facilities. Make available external and internal condoms as well as lubricant in a range of spaces across the facility, like waiting area, toilets, gate, pharmacy, consultation room, quiet areas, out of sight, so people can freely and easily collect them. Ensure that PrEP is offered to everyone, including key population who are not living with HIV or test negative for HIV, with information shared on its benefits. Ensure that all facilities provide gender-affirming services, including using trans people's correct name and pronouns, providing a gender-neutral toilet for trans people, respectfully asking trans people with color folder they are more comfortable using, either pink, blue, or red. Ensuring that trans women are not made to use men corners. Maintaining privacy and confidentiality, additional healthcare workers and clinic staff should not be called into consultation rooms under the guise of helping, when often this is to mock and judge trans people.
The next set of issues are on infrastructure and clinic condition. The country load shedding crisis negatively impacts the provision of healthcare in our clinics and can often lead to people waiting much longer to collect medicines or consult with the clinicians. In uMgungundlovu, most common challenges include delays in finding files when filing rooms are in darkness. Generators at each facilities could resolve these challenges, but only 21% of facilities reported their generators are not working. On overall cleanliness, 97% of public health workers, of healthy care users reported that facilities were very clean. And uMgungundlovu was among of the top performers across the district and Ritshidze monitors. Now we're moving to the recorded stories.
Siphuma endlini around about 4:45 because usuku zama ukuthi ube at least before so sime emgaqweni lapha kwishelter kufana nokuthi sisemgaqweni ngoba ama-taxi ayadlula lapha le shelter le abangena abaqonde kuyona uma sekuyimaki kuyibayongena ngaphakathi abagulayo bahlala la ukuma ngaphandle ngamanye amasuku siriska ngempilo zethu kodwa sibe sithi sizongcina impilo ngifisa nje ukubona iclinic yethu ithuthuka ine staff enough for ama patient. So ngifisa nje kube khona insiza kusebenza njengenye icomputer ezokwazi ukulekelela umabhalane lomunye uma computer abe u2
in the most common reasons. We can also move to recorded stories.
Yeah, in the infrastructure, our clinics ethu mancane, our renovator, and when you ask why, they tell you all the stories. But when, as we are talking now, the National Department of Health has a deficit of 10 billion. Yes, strike, and the department does not know where they're going to get this money. And part of this money, bazaithatha from the budget that has been allocated for building clinics, renovating clinics, which means impilo zethu thina as umphakathi azibalulekanga. What is important, ukukhuphula umholo of some of the nurses that are ill-treating us, and we are expected to accept this. We go to clinics, you wake up as early as 4 a.m. on a rainy day. You're standing outside 4 a.m. and then by the clinic go 8 o'clock. The rain is still falling. You're standing outside, there is no shelter, there is no nothing. And you are expected to be happy about that. And you are expected to understand. So I think as umphakathi nathi and as well as community-based organizations and political parties, we need to hold them accountable. It cannot be true that political parties only come to us when they want our votes. Not long ago, bazoshaya door to door. But when we want services, we do not see them. So at some point as umphakathi, we need to punish the politicians. And if it means we stay away from elections until our problems are resolved, let it be. But we need to hold everyone accountable. If it means, as the public healthcare users, as people living with HIV and TB, as key populations, we need to organize and mobilize occupiers long as the legislature, including parliament, and demand quality services, let it be. If health is a fundamental human right, it must not be a rhetoric. We must see that being implemented on the ground. So the recommendations on this one are as follows. The Department of Health should ensure that all public health facilities have a functional generator or to generate in a petrol as your department. And we do not see this happening, more especially during the time of load shedding. Ezinye zinazo generator, ezinye zinazo, zintshontsho kwi-clinics zethu because ii-clinics zethu zine-security guards that are holding baytongs against abantu abaphethe isibhamu, and you expect abantu abaphethe ibaytong to fight against someone who's carrying a gun. That is a dream. The Department of Health should ensure that all public health facilities have a functional generator with sufficient fuel and rechargeable bulbs so that health services and administrative work can continue during load shedding. Ensure that all public health care users are consulted, tested, and or counseled in private rooms. Carry out an audit of all facilities to assess infrastructural challenges, after which the department should develop a plan in order to renovate buildings and ensure adequate space to provide efficient private and safe healthcare services. The department must publish the audit results. In the interim, provide temporary structures and ensure that more people living with HIV are being decanted out of the facility and receiving longer ART refills to reduce the burden of overcrowded clinics. Ensure that all facilities are maintained to the highest standards of cleanliness, including through implementing regular cleaning rotas. Ensure clinics have resources to provide soap and toilet paper in all toilets.
The next group of issues, which are the last one, are on TB infection control. In South Africa, around 300,000 people develop tuberculosis every year, and about 56,000 people die. Yet, TB infection control in our public health facility remains inadequate. By following a simple checklist of good practice, including key measures that were implemented during COVID-19, facilities can be safer for public healthcare users and staff. With the checklist in mind, Ritshidze has developed a scorecard and a traffic light system to rate the clinics on how good their TB infection control is. Clinics that are adhere to all the measures are given the green light. Those that are on the right track but still off target get a yellow light. And a red light is given to those that are way off the mark of ticking on all the checklists for the 6 measures. In July and August 2023, no facilities were awarded green status for checking all 6 measures on the scorecard. 10 facilities were awarded yellow status for following about half of the best practice measures for TB infection control. 4 facilities surveyed failed altogether at meeting these 6 basic best practices to stop the spread of TB. I believe we have one.
Greetings to you all, fellow comrades. Igama uNompilo Madlala, residing in France. Ikliniki ebengalisebenzisa impilo enhle clinic. Bengingalisebenzisa iklinik as per se, bengisebenzisa imoto yakhona to collect amaphilisi ama-HIV. I'm living with HIV and TB at the present moment.
I am a person that uses Impilo Enhle Clinic, but I was not necessarily using the clinic per se. I'm using their mobile clinic as a person that collects my ARVs and my TB treatment.
So this year, not sure of the date, got around the 1st, 2nd of June, a family member of mine, engahlali naye endlini, was diagnosed with TB. We were called in a Grange clinic where she had coughed and we went.
A family member of mine tested positive for TB. I don't reside in the same house with this person, but everybody that is close to this person was called into the Grange clinic to be tested for TB because that's where they were tested for TB.
Okokuqala nje engikunoticile ngifika khona ukuyokhwehlela, there was no counseling. Sifike nje kwabhaliswa kwabuza ukuthi uyasazi status sakho, kwabo ukuthi ya ngiyasazi, I'm on ART, ngihamba Impilo Enhle clinic, okay fine, here's izinto, go and cough in that room lapha kuleya shelter.
There was no pre-counseling and nothing was explained to us before being asked to go give a sputum sample. They just asked our statuses, if we knew whether we're HIV positive or not. And for an example, I knew my status, so I told them that I was on ART, and they just gave me the container to go give a sample of my sputum in.
Akukho futhi okuningi abasichazela kona ngokuthi kuzokwenzakalani emva kwaloku kukhwehlela. So I went home, it was a Friday, and then on Saturday afternoon I received a text saying that I must rush to the nearest clinic.
They didn't explain anything to us, they didn't specify anything. Kodwa into bayenzile ukuthi basitshela ukuthi bazositshela ama results masiwabuyi. Bekungolohlanu ke mase eclinic bathatha sputum ngomgcibelo ngathola SMS ethi mangiye eclinic eseduze nami.
I felt ukuthi okay, it was good for me because clinic yami ikude kunami Impilo Enhle. In France we do not have a clinic. It's either we use Impilo Enhle or sisebenzisa iGrange. Since ke mina vele ngi on treatment and date yami ibiseseduze ukuthi since besizoyeka ukulethelwa imoto amaphilisi, I was supposed to go to the clinic ukuthi baphinde bangihlelele ukuthi ngiwalande khona amaphilisi.
I decided to wait for my next ARV pickup appointment date because it was very close to me having to go there. The challenge was that we don't have a clinic specifically where I reside. Both Impilo Enhle and Grange are far, so I decided to wait for the next appointment date to go show them this SMS that I had received.
The one day that was left, which was Sunday, dragged. It was like it was the whole year. Ngihleli endlini, waiting to go to the clinic on Monday. Well, I did on Monday. Ngaya e clinic. Took a taxi because bengine stress and ngazizwa nje ngiweak ngazizwa ngithukile because amanye ama family members they received messages saying they are negative. I was the only one who received a message not stating ukuthi what is happening with me.
Njengoba sekachazile ngesizulu nangesingisi, uyayedwa emndenini ebekathole iSMS echaza ukuthi abazi ukuthi umephi nge-status sakhe se-TB kodwa bonke abanye bomndeni bebathola ukuthi i-TB abenayo. So washesha wathatha itekisi ke ngomvulo makakhona ukuthi akhona ukuya eclinic eSempilo Enhle.
Ngafika eclinic around about 6:30 in the morning. Uma ngifika khona eclinic I did not have my card. Nje bakade ngichazile ukuthi thina nje besilethelwa imoto endlini yomunye umuntu oyiwani lapho amakhadi ethu abekahlala khona. So if sengifika khona eclinic I went to a clerk or a receptionist, I don't know what they call them. So mangifika khona ngifika ngiyamchazela usisi ngithi I lost my card. So ngicela bandla ungisize anginalo ikhadi uningikhiphele ifile. And bese ngiyambuza ngithi khona imessage engiyitholile la efonini angazi ukuthi ngenze njani athi hamba uhlala phansi sizoza kuwena nina nilahla amakhadi bese nifuna ukusisanganisa nina abantu bemoto nje angazi niyenza ukuthanda kwenu nje.
Because the mobile clinic program was going to come to an end when it relates to bringing us our ARVs. I then went to the clinic and told them that I was using the mobile, but they've told us that they're stopping to bring us our ARVs. Hence, I came to the clinic. I also explained to the clerk that I had lost my appointment card because the cards were kept where we were collecting our ARVs at the external pickup point. I also explained that I had an SMS that I didn't understand. She shoved me away, telling me to go sit down because the people that are from the mobile van were a problem, were a nuisance, and they lose cards and come and want to cause stress for them while they're at work.
I sat there for hours ngingasizakali abantu abafika emva kwami bangena balithola usizo and then kufike kule point la ngizwa khona ukuthi sengikhathele and I'm going to stand up for my rights ngasukuma ngabuyela etafuleni ngabatshela ukuthi no, this can't be happening. Ngifike early kabi ukuthi ngingabe ngisahleli la. At that time I was writing my exams. I was writing my exams. I was supposed to meet with my tutor in the afternoon. So ukuloke ngihleli lapha bengizoba late and then I'll end up ngikhokhela umuntu for i-service engazange ngiyithole.
I waited for hours up until I decided to stand up for my own rights, went to ask what was happening because people that had arrived after me had been assisted and were already leaving. It was during my exams and I had hired a tutor for which I had an appointment with later that afternoon. I felt as though delaying and being kept at the clinic for the whole day is going to force me to now pay the tutor for a service that they didn't provide.
When I finally got my card, the people that were behind me knew ukuthi mina ngiphambili, so they said immediately when I get my card ngingene ngaphakathi, so I did. Uma ngingena ngaphakathi usister wakhona noticed ukuthi angihambi ikliniki ngilethelwa imoto. She had some remarks nje angathokozisi.
When I went into the consultation room and the nurse realized that I was not a person that was collecting from the facility but was collecting from the mobile van, she had unbearable remarks that I didn't understand.
Futhi okunye ke nje okwangiphatha kabi khona ukuthi emotweni vele siyawathatha amagazi but imphumelo ayibuyi futhi asizazi ukuthi simephi ngo viral load bethu no CD4 count. And amanesi if alwa nohulumeni ngezinto uhulumeni aziphosa kubona bona kufanele ukuthi balwe nathi, because that day I noticed ukuthi le system yokuthi silethelwa amaphilisi ngemoto o sister ba against o nesi aba against yona abazwani nayo.
In the mobile van, they would take our routine viral load, but they will not give us the results. And I realized on that day when I was at the clinic that the nurses were not for the system of the mobile van, but the whole idea was for me to say they shouldn't be blaming us or making us as patients suffer for a system that is failing them, that is created by the same government that they work for.
Okay, Umay says she went through my file and then she said it's not my date, since isn't wrong, and then my viral load is high, and she was referring to me as viral load when she talked to me.
She looked at my file, realized that it wasn't my date, and started referring to me as viral load. Mind you, at this time, I did not know my viral load because we were not getting our results back from the mobile clinic. She also continued to say that it wasn't my date, I wasn't supposed to be there on the date. Us, whom are the people that were collecting from the mobile, are complicating and confusing the system at the clinic.
Okay, right, and then I said, okay, it's fine because I still have the pills, but now there is another pushing matter, pressing matter. Nanti message ngene phone. Ngicela ukubuza ukuthi ngingasizakala kanjani because esibhedlela bengike ngibone noma ngilele khona kunamanye amagazi ami akwezinye indawo, they could track ama results ami from my phone. So I asked her if she could track my results because I've been sitting there for the whole day and ngine appointment. Wathi ngeke akwazi ukutracker, and then I asked her ukuthi kanjani athi akakwazi ukutracker because there is into serial number ebhalwe lapha which she can check with, because nami ngi-anxious ngifuna ukwazi ukuthi what is happening with my health. Ngisengicabanga nabantu ebengihlala nabo eklasini engikhwehlelela eduze kwabo bonke abantu engibe in contact nabo. Everything is just going through my mind at that moment. I'm stressing about the exams, I'm stressing about my health, I'm stressing about behavior yabo towards mina ekliniki at that time. And she is telling me ukuthi buyela la ukhwehlele khona because thina ngesikwazi ukukusiza la. I sat there and cried. She called another nurse in.
So I explained then to the nurse that we can put the ARV issue aside and focus on the SMS that I had received because it was not clear what was happening. I requested that she please follows up with my results using the serial number on the SMS, and she told me she couldn't do that. Instead, she sent me to the facility where my sputum sample was taken, and at that moment in time, I was now contemplating about the people that I reside with at home, the people that I was with in the taxi, the people that I was sitting with in the facility, not knowing exactly if I had the TB infection or not.
When she called in this other nurse, they tried to track my results. Bawatola and maybe watola ati asymptomatic. They did not explain to me what that means. They still said angwele ekliniki la engikhwehlele khona ngiyasiyathanda ukubenzela overload angibuyele la. I cried and asked ukuthi bangibizele umuntu obaphethe, their superior.
When she called in the other colleague into my consultation room, they managed to track my results. Did they say you're positive, TB positive?
Asymptomatic. It's written asymptomatic.
Okay. So the test results said that I was TB positive, but they still were not explaining anything and also continued to send me to the facility from where my sputum test was taken.
So when their superior came in, I was not satisfied in ngendlela athatha ngayo imatter. You could see she's taking sides. You could see ukuthi she'd rather lose a client than a staff nurse. Ukuthi she'd rather she'd rather lose me kunokuthi abe short staffed. She didn't nje ukuthi akhombise ukuthi, instead she kept on insisting ukuthi, no, this is protocol, this is procedure, sisi. I'm sorry if you're feeling hurt. This is how she just talks, because she was shouting at me. Angithandani ngendlela ayikhuluma ngayo. So they were saying, hayi indlela akhuluma ngayo nje unganaki sisi, wena buyela laphayana ucela i-transfer na masebe ku initiateile ubuyuze la.
When the facility manager's intervention was not to my liking, it was not satisfactory because she kept on emphasizing what the nurse was saying, and they kept on telling me or asking me to rather accept this nurse's way of speaking to me because apparently that is how she expresses herself. The facility manager continued to suggest that I go to the facility where my sputum sample was taken, and then ask for a referral to be sent back to this facility to access my treatment.
Cut the story short, ngagcina ngithathile i-transfer letter yabo, nayo bafake emphasis yesiZulu, although they were writing to another person who was learned like bona, but they wrote in isiZulu it transfer letter yami with emphasis on next to viral load wami ukuthi manage 40 viral load, written in big words. So I really felt degraded, and I felt ukuthi service yabo was undignified. Ngathuta from their clinic ngaya eGrange. They welcomed me kahle up until last month. Last month mengifika eGrange, there is a queue yabantu abaya kudokotela. Then there is a queue yabantu abazo collect amaphilisi.
I then took the transfer to Grange Clinic as they were advising me because I was now not satisfied with the treatment and have been happy with Grange Clinic until last month when I went to the facility and there were two separate queues.
So ngifike kuseni kakhulu clinic because I'm rushing. I recently found a job. So ngiyasaba khona ukuthi ngicela ukuthi ngicela bandla ukuye kuyolanda amaphilisi. Angifuni kuze kuthiwa engathi uzobuhlupha lo.
I arrived extremely early at the facility trying to push time because I had recently been hired, I recently got a job, and I was afraid to ask for a day off from my workplace. As the newly hired person, I felt that they would assume that I wasn't serious or was not in real need of this job.
I understood ukuthi indlela abasebenza ngayo ukuthi baqala ngomuntu kaDokotela because uDokotela uyahamba at a certain time. But when abantu baDokotela bephela, then I had to go in. Unesi wakhona had a very bad attitude towards me.
I understood that according to the two separate queues, the people that were supposed to take their vitals first are people that had appointments with a doctor. But as soon as those people were done, as soon as they were finished, I walked into the consultation room and the nurse didn't attend to me with a proper attitude.
Mangifika ngaphakathi athi angikubizanga ngithi mina lo phumile uthe next athi ngisho abakaDokotela, and then I told her abakaDokotela abasenawo amafile yimo nefile. She sat there, she sneered at me, she said, and then she purged through my lotuzana ifile yami, athi, okay, kodwa bengifuna abantu abaDokotela, and then there was a knock on the door. Then ama patient ade fike emva kwami angena. Uma engena lama patient afike emva kwami akhulume nawo, I'm sitting there like islima manje. Abatshela ukuthi abagibele esikalini mina ngihlele eceleni komshini wokufutha.
When I went in, the nurse told me that she hadn't called me in because she was strictly dealing with patients that had an appointment with the doctor. I explained that patients that were going to see the doctor were done and I was next on the queue, and then she just sneered at me and asked me to take a seat. As I was about to be assisted, there was a knock on the door, other patients came in and she started assisting them, and I was just left sitting there waiting for them to finish.
Utshele lo sisi ukuthi akagibele esikalini, wambuza isikali, wathatha ikhadi lakhe wabhala phansi, and then she asked me to move from the chair so she can take iBP yalo sisi. I just got shocked ngama futhi eceleni kanjalo, wambhala wamenza wathi qeda wamkhumula iskipa. I think usisi ube noshukela waminjector la esiswini, waphuma usisi wahamba.
After taking the other lady or the other patient's weight, she then asked the lady to take off her top because I think she was administering insulin, and this was all happening in front of me.
Uma ephuma usisi kungene elinye patient lithi patient phuma madlala uyasibambezela, ngithi no akumina ngibambezeli lunesi, and then unesi athi ubizoba uzuthi ngiyakubambezela mina ngikubizanga wena, and I was shocked.
Another patient was about to come in because they saw the other two ladies leaving and asked why was I delaying the process. I explained to the patient that it wasn't me who was delaying the process, but the nurse was busy assisting other people. The nurse then responded to me, rudely so, saying that she had not called me in and she doesn't understand why I'm blaming her for delaying the process.
Kule game ke bengeke ngize ngicela transfer. I said I'm going to take it head on. Sizodila nale ndaba. Ngihlale naye phansi ngithi I do not like the way ukhulume nayo ngami. I did not like indlela owenze ngayo. At least you should have asked me ukuthi ngiphumele eminyango ungakhumula omunye umuntu ngisendlini because you do not know my sexuality. Ukhumula umuntu wesifazane ngila endlini mhlambe nami nginama feelings abantu besifazane. It is totally wrong lento oyenzile.
I explained to the nurse that I wasn't pleased or amused with her choice of working. I explained that the situation where she asked the other lady to take off her clothes in front of me was very unprofessional. Because at this point, I was not willing to take another transfer letter to another facility. So I decided to tackle this issue head on.
Uma ngimtshela ukuthi angikho happy ngeservice yakhe, she said first door uma ungena la umphathi shona khona.
She advised me to take my issue to the facility manager.
When I went there, kwathiwa umphathi akekho, ngabona ukuthi okay, that's why she was feeling confident ukuthi angiye khona, and I wanted the second in command waloyo. Ngamthola usemadlala wakhona eGrange, wanginikeza incwadi yokuthi ngigcwalise ngifaka ama details ami ngibhala story sami. I did so. Up till today, I'm still waiting. Nobody has called me. But kuko konke ngithanda ukuthi ngikhomende ngithi nje ngiyaphambili ngo sister Nzimande wase Edendale Hospital who takes izinto esizibhalayo to suggestions box very seriously. No sisu samke Mncube, I wrote an email one time ngingaphathekile kahle eEdendale Hospital. It took about 10 minutes ukuthi anginikeze iresponse and bayilandelela into engangikhala ngayo Edendale iyasebenza. Engifuna ukusho nje ukuthi kuko konke akuwo wonke ama facilities amabi kukhona la khona othi uma ngabe ukhulume ne management khona yakhona ikusize, but kwezinye indawo into enginotisayo ukuthi abonesi bayasidelela because bayazi ukuthi they are in cahoots nalabantu ababaphethe ama facilities. Siyacela ukuthi abantu abaphethe ama facilities abasiphathe with fairness, abangathathi amasayidi amanesi bayilalela idori zethu because at the end of the day yimpilo efunakalayo, sizofa sibulawa ukuthi abasiphethe kahle.
Thank you. We go to the recommendations. I'm not gonna say anything because time is against us. And people are hungry, and food is gonna get cold outside. So, but one thing that I want ukuthi siyazi la ekhaya ukuthi sine problem eNingizimu Afrika ye tuberculosis. Ebulala abantu abaninzi. Maqabane kalokhu meeting is on. Comrades, meeting is still on. Meeting is still on. When you were talking and telling your stories, we listened to you. Can you listen to us as well? Thank you. We've got a problem in South Africa of tuberculosis. Ebulala abantu more than COVID-19. According to a World Health Organization report, as James was reading here, in South Africa, we've got about 56,000 deaths of TB every year. Out of that 56,000, about 33,000 of those people who are dying of TB, 33,000 are people living with HIV. When you divide that 56,000 by 365 days, iyasitshela ukuthi ngelanga in Ningizimu Africa abantu aba 153 are dying of TB. And inkinga esinayo i-medication ekhoyo and effective ye-TB, it is still expensive, and only those who can afford, who are able to get an effective TB treatment. And it therefore means we need to fight. That's why in 2021 we marched to Didi Mabuza, Nozweli Mkhize in Bombela as TAC, to force our government to to declare TB a national health emergency, to do to TB what they did to COVID-19. And then after that, they appointed Dr. Njeka, baza ne TB recovery plan, but we do not see isebenza on the ground. Maybe we need to double our efforts to make sure that TB becomes a priority in our country. So, the recommendations are as follows. The Department of Health should issue a communication to all facilities stating that all windows must be kept open, TB infection control posters must be displayed in visible places in the waiting area, public healthcare users must be screened for TB symptoms upon arrival, people coughing or with TB symptoms must be seen first to reduce the risk of TB transmission. People coughing or with TB symptoms must be provided with masks. People who are coughing must be separated from those who are not coughing while waiting. Carry out a full audit of all public health facilities in the province to assess TB infection control based upon World Health Organization guidelines, after which the department should develop a plan based upon the infrastructural, human resource, or behavioral challenges found in order to improve TB infection control. The Department of Health must publish these audit results. So now we're moving towards the end, and before sinikezele ku Department of Health to respond, as I mentioned, kuzikhona inhlangano zomphakathi ezikhoyo la. Zanicela amaqabane ixesha luchapha. Zawucela amaqabane 2 minutes, 2 minutes, 2 minutes, and then after that we give it department. I do not know who is going to comment or respond, but the expectation is not for it department to respond to all of these things. So I am told ukuthi ucomrade from Napwa akakhona ngufika. Ukhona comrade weNapwa? Umoli Kubeka akekho. So sizabiza comrade Promise Memela from PWN. Ukhona? Akekho. Sibize uMdikoni uNzama. Ukhona? Over to uMdikoni.
Sanibonani. Igama lami nginguXolani wakwaNzama. Ngingumfundisi waseLuthela Escort. Ngimele uSanerela la kwi-province yase KZN. Mhlambe kumbalo umuntu angafisa ukukuphawula okokuqala sibonga kakhulu lesi sithangamo noma le kuthiwa yini lokuhlangana okufana kanje, and I'm sorry ngazo zonke inkulumo umuntu azizwile. Inhlangano ke yabefundisi uSanerela lapha eKZN inhlangano ekhathazekile ngesimo se-HIV and AIDS, ngoba abantu laba aba-HIV positive angeke sikufihle ukuthi ngamalunga ethu ebandla, even noma ngakuthiwa abakhonzi la sikhonza khona, kodwa ngenxa yokuthi bangamalunga omphakathi bayingxenye yethu njengamalunga ebandla, futhi sihlangana nabo day to day. Ngamanye amazwi ilanga la singahlangani khona nabantu abahlukene. Ngicela mhlawumbe ukukhuluma kanje ningangiquote kabi, ngibe kunomfowethu okwaPaula laphaya ngodaba lamaphara. Ngiye ngathi nawo amaphara njalo angabantu, engabantu enjalo azalwa yithi, ethi ezalwa yithi nawo angabantu futhi adinga ukuvikeleka nokusupportwa. Sikusho lokho ngoba njengoSanerela siyakhathazeka ngabo futhi bayingxenye yethu ngokuphelele. Ngicela ukuphawula lokho ngiya ngasekugcineni. Awukho umgodi njengeSanerela esinawo wokulahla umuntu. Singena umgodi ngifisa ukuthi kwa wonke ama stakeholders akhona, let's create working environment smooth kuwo wonke amazinga okuphila kwabantu. Ngakho ke futhi sifisa ukukhuthaza namabandla a create a safe space la khona abantu bezokhuluma khona ngokukhululeka. Ngenza nje example yokuthi ibandla uma kuqhamuka somebody officer ukuthiwa ukuvela obala ngesimo sakhe kuyibandla alingasho ukuthi hayi usuyisonike wena akusafanele uyisondeze. Ibandla limele accommodate wonke umuntu njengoba usanarela futhi enza. Sikhuthaza futhi ukuthi kwemukeleke kuyo yonke indawo la abantu behlala khona, ikakhulu amabandla ethu awabe isizinda la khona imishanguzo ingatholakala khona eduze. Mhlambe angikusho nje ukuthi njengoba sonke sikhona la akekho umuntu ongekho eduze nesonto elithize. Ngamanye amazwi if ufaila ukuya elokhozaneni eclinic luthola usizo esontweni la khona izindlu zamasonto ukwazi ukutholakala khona imishanguzo. Ngamanye amazwi ngifisa ukuthi ke njengosenerela sivule izandla ukuthi amabandla abe yikhungo zokulanda kwama ARV la khona sisebenza khona no Department of Health. Ekugcineni we are all equal in the eyes of the Lord. Ngiyabonga.
Thank you Mfundisi wami. We are blessed today, Mfundisi. Sizawubiza uPastor Mzamo Zondi from Treatment Action Campaign and the provincial leader of TAC. Over to you, Pastor. Oli Pansol, over to you.
Mandla, awethu, long live TAC, long live. Long live Ritshidze, long live. Mandla, long live the spirit of no compromise, long live. Sibonge. Ngitha angisukume noma kunzima kodwa ufuna ukuma. Angibingelele ubuholi bonke beRitshidze, ubuholi bomnyango. Siyabonga kakhulu ukuthi sishilo sathi ekseni ngabo 4 sidinga omanager ngoba into yayizolo isikhombisile ukuthi noma ningakhona njenge district kodwa facility manager sibadinga kakhulu ukuthi nabo babe ingxenye yokuzwa lama stories ngoba uma bela bezwa ukuthi abantu baphatheke kanjani kuzosheshe kulunge. Ngoba umuntu umethi ngihlukumezeke eklinikini yakho ukhona ufacility manager lokho kusho ukuthi leyo into ufuna ilungiswe ngaleso sikhathi. Kodwa okubaleke kakhulu on behalf of the TAC ukuthi lo nyaka lo ka 2023 unyaka omaka iminyaka ewu25 sibe no TAC. And lo nyaka lo uma ubala from 19 November 2023 unyaka ka 20 on how the people's power broke political resistance. And lo nyaka lo ungunyaka umnyaka ewu19 la kwathi ngo 2004 ngo April uhulumeni waqala ukuroll out ARVs. Okubhlungu kakhulu kuthina njenge TAC ukuthi konke lokho akuzange kwabalula. And manje wonke lo msebenzi ongaka owenzekile emva kweminyaka eminingi kangaka ubonakala nje uzoshabalala ngenxa yabasebenzi bezempilo abangaziphethe kahle, ngenxa yabasebenzi bezempilo abangenawo unembeza wokusebenza abantu. Uma ulalele kahle la okusiphatha kabuhlungu njenge TAC ukuthi abantu abaningi abala bayazitshengisa ukuthi bona they silently transfer themselves from one facility to another facility. and uma bez transfer bona bazange bavalelisa la kade besuka khona asazi ukuthi la besuke khona mhlambi abantu enibabhekayo nibheka abantu eningazange nabaphatha kahle nini so ke lokhu ke kubuyisele emuva ukuthi kulabantu ekuthiwa balahlekile kusho ukuthi kufanele ukuthi ifacility kube khona umhlangano we-district la ifacility izozana abantu bayo kubheka ukuthi labantu laba ekuthiwa balahlekile ngoba ngenzeka kuba abaningi uyabona ukuthi umuntu usuke kule facility kube kuthiwa ngikholwa nje bengizothi ehlangane noneso ispoki waya kwenye facility ngoba ephatheke kabuhlungu so uma sifika ngoba asinayo isystem ye department etshengisayo ukuthi umuntu noma ngasuka la ayepha kwazi ukutholakala kalula kodwa lokhu kubiza ukuthi ke abaholi laba bala be-district bama facilities bahlangane kube khona umhlangano omkhulu noma wensuku embili la kuzobhekwa khona ukuthi umuntu kungenzeka kube ufuna umuntu osuke kwifacility yala eMpophomeni wayemafakatini ufuna umuntu osuke la wayeHawiki but okubhlungu kakhulu ukuthi abantu bathatha lezo nqumo hayi ngoba bethanda because circumstances are demanding them to do so and it's hurtful ukuthi sihlangene la lokho kubangelwa wonesi abangaziphethe kahle you know the price of defaulting when I was eMantungweni the price of defaulting is to die uma ama patients echaza kanje athi umuntu ngihlala isikhathi esingaka emva kwaloko ngingayitholi treatment ngenxa nje ukuthi ngahlukunyezwa unesi eclinic so as the treatment action campaign we welcome this Ritshidze report and we want to work with you the Department of Health ukuthi senze lo msebenzi ka Ritshidze noma le report ka Ritshidze ukuthi ibe recovery plan ye HIV so uma singayisebenzisa kahle lokho kukhomba ukuthi izinkinga zonke esibhekene nazo njenge province yaKwaZulu-Natal zizokwazi ukuthi zinqobeke okugcina ngci next time sithola inkinga efana nale we'll just go and occupy that facility asikwazi ukuthi sibe nabantu ugibela ngani umuntu ukusuka eFrance edolobheni engasebenzi ugibela ngani umuntu ukusuka eMpophomeni adlule ahamba edolobheni engagibeli ugibela ngani umuntu ukusuka eGomane ahamba aye eSpom imalini ukusuka eMpendle uye edolobheni for umuntu ongasebenzi so lezi izinto ezenzakalayo zibiza ukuthi ke kubaleke kakhulu ukuthi uRitshidze uSanarela uPWN uTAC noNAPWA sibe nomhlangano obaleke kakhulu la idepartment uMgungundlovu uzokhipha iplan yawo hayi le province yayibona le province sifuna idistrict ke manje ukuthi idistrict ikhipha sihlale phansi kuplan ukuthi idistrict izokwenza kanjani ukuthi iimplement ama recommendations enziwe iRitshidze siphinde futhi size la ekuhlaleni ayifonda ucancel umthalane wale ward ekseni and I said cancel umthalane gode ngizoqala lapha kwiDAC but wena gode uyokwamkela abantu lapha ewadini yakho so njengohlalo wewak uzokwazi ukuthi zithini inkinga zabantu so ke kubaleke kakhulu ukuthi sihlanganeni sisebenze ndawonye ukuthi silungise izinkinga ezikhona kodwa kusuka manje comrade GS we are going to declare 2024 as the year of people's power and labantu abangabaphathi kahle abantu emaklinikhi they must go we must start those campaigns esasiyenza njengekaMantu ethi Mantu must go but okungiphethe kabuhlungu kakhulu la I saw two leaders of the TAC the second chairperson of the TAC uComrade Thandanani Mvuno who was a provincial chairperson of the TAC and I saw Comrade Menzi who have just left here and kubhlungu kimi Thandanani uma sazi ukuthi niqale lo mzabalazo nabo sikhumbuzo as early as 1999 when we were still at school and lo mzabalazo lo eniuqalile niyadingeka manje njengo former chairperson ka-TAC ukuthi umsebenzi eniuqalile ukwazi ukuthi nibe ingxenye futhi ukuthi siufeze. Thank you.
Thank you, Mzam. As I am going to hand over to the department, two things. Bapat, ababantu who have disengaged on care in the Bakangelayo, Tina as TAC, Ritshidze Napwa, Siabaz, in majority abo ilan. And if we want to link them back to care, let's work together. Because Tina, we've got eyes and ears on the ground at community level. Let's work together so that we can all make sure that we're saving lives. Mzam, thank you, Bafo. Uti, as the KZN, you are declaring 2024 as the year of people's power. When you organize that meeting, as NAPWA, TAC, SADARA, and other organizations, Ningas Khohlwa, Healthcare Workers Union, or Tenosa, Nehau, all of them, sit down with them and explain to them what members of their organizations are doing to the community. So that when we attack or fight back, these unions do not come and accuse us of things that we are not aware of. As you are doing it at district and provincial level, Nati, we will assist in doing it at national level. Because at the end of the day, I said to TAC comrades during the strike, Bapat, Kustiwa is solidarity, Dabuzi solidarity Naboban. We are not going there. We cannot pledge solidarity with e-unions that are violating the rights of the public healthcare users. If the healthcare workers unions wants a support here to Ezumpagati and TAC, they must respect our rights. We will respect their right to strike. But if they continuously disrupt services, why should we pledge support with them? The least we can do, let's interdict their strike so that the strike sabo does not affect us. In those few words, and the Azigaba says, or ukhona umama uhlengiwe is on Zoom, umama uhlengiwe Ngobo, ucela ukhuluma qala from e-Health Systems Trust. Khange ndiyazi ba ukhona. Siza kunika 3 minutes mama uNgobo. Emveni koko sinike i-department balambile abahlali. Over to you mama uNgobo.
Ngiyabonga kakhulu Chair, ngiyabonga kakhulu team enilapho. Igama lami nginguhlengiwe Gcaba, uMangobo from Health Systems Trust. Ngila kwenye meeting ngikanye nobaba uchair we-civil society ubaba uJohn Fokeng, mase ngiba no deputy chair we-civil society umama uZikhona Nyathi. Ubaba uchair uthanda ukuthi kulo 3 minutes kube khona kubekayo, kanjalo nomama udeputy chair uthanda ukuthi kube khona akubekayo. Ngiyabonga kakhulu.
Sibingelele sihlalo nomhlangano wonke mhlambe umuntu akaqale ukuthi aneke axolise ukuthi asibanga ingxenye yomhlangano physically ngenxa ye commitment ebesinayo as a district la besine planning meeting namhlanje ye World AIDS Day ne GBV. So ubaba uZondi lo oqeda ukukhuluma ukhulume kahle ubezimele ukhulume kahle siyayisupporta into ayishoyo ukuthi eneke we need to take action for 2024. So thina as a civil society yaseMgungundlovu we want to pledge our support ukuthi eneke yonke into isector yethu eyenzayo we are going to be part of it, and they are us and we are them. So we are going to fight together ukuze abantu baseMgungundlovu bakwazi ukuthi eneke bathole ama health services ngendlela efanele. Ngoba sibhekane nesimo sokuthi khona manje second 95 asikwazi ukuthi eneke so achieve. So siyabona ukuthi eneke mhlambe siyaw achieve, but it's because of a negligent no ukuthi eneke ama services awayenzeki kahle ngendlela Yona lento yenza ukuthi neke abantu bahambe bangareportanga kuma facility ashintshe facility ayibuyenge. So siyabonga kakhulu comrades kakhulukazi uRitshidze nge uku-organize le event nokuthi neke akwazi ukuthi athathe le initiative ayithathile. We are together. Ngiyabonga kakhulu.
Thank you so much. I greet you all. I will just say protocol observed. Igama lami nguZikhona Ngwakanyathi ngiqhamuka kwi-organization ekuthiwa Inkunzi Sematholeni Foundation esebenza kakhulu about key population engicabanga ukuthi sike sakhuluma kakhulu ngayo laba sibabiza ngamaphara. So I really appreciate i-report engiyithola ku-Ritshidze because what you have tabled down in terms of e-service delivery when it comes to ontandane no mama para is a true reflection of what we've encountered. We community, what we've encountered in my clinic as well when it comes to base visa, because as Bishop Gadeshilo okulume before there are also people and they also need services, and majority of them we've discovered which is they are HIV positive and they need to be treated like any other individual, because it's a basic human right to service. And it doesn't only affect them in terms of service delivery, it affects song as a service, because labo lost to follow. Once what test what positive, what medication. If a sebu next time you say service, lo muntu automatically becomes lost to follow. And for us as an organization, as isebenza nabo kakhulu, kuba nzima kwesinye isikhathi ukuthi senze ama follow up, because if ekutshela ukuthi angeke ngize ngiye clinic ngolanda amapilisi because of the treatment that I've encountered. So ngiyafisa ukuthi iqhubeke iRitshidze to do as much as possible to deal with lama issues e service delivery, more especially when it comes to healthcare workers. Thank you so much.
Siyabonga. Andiyazi noba umama lo we Health Systems Trust usezoqhubeka kakhulume okanye niqedile manje.
No, Baba, siqedile okwamanje, but wonke ama points that have been raised in terms of ama recommendations and support that needs to be given will be actioned, will be discussed with the bigger team together with district. And as a suggestion was being put forward, there needs to be a district plan around e-service delivery. We will be definitely supporting that together with UDOH. Thank you so much.
Siyabonga Zinkokheli. Thank you very much for your patience. Hey, my lead, I do not know whether your smile is calling me to give you the mic okanye. What must I do? It's not patriarchy, but I'm asking. Or all of you want to comment? Oh, it's the arrangement is yours.
Sanbon. Igama lami nguSanele kwakaMadlala. Umphathi waseMpofu Community Clinic. First of all, I'd like to thank nje uRitshidze ube eye opener kuthina as health workers. Well, we know ama complaints ahleze khona. But njengamanje uwenza iphinde siwathathe into more considerations because people are so unhappy about us. And I can tell you, as Sufola, there was this embarrassment about umsebenzi wethu. We don't like it. But it's now a drawing board. We will sit down with the team. Akhona ama complaints, suggestion box. But bashilo ukuthi vele sometimes sibuye singawalokho nje. But we do open them. It's just that it takes time for a response. Bantu uthola ukuthi umuntu uphatheka manje engathi angasizakala manje ayithole manje i-response about the complaint yakhe. Mina as a facility manager le performing ngine open door police sahlala na ukhansela. Abengqongqoza manje ngithi ngena manje. I don't wait ngithi hamba obhala lapha ya. No. I think that can also help ekutheni inkinga zabantu ama complaint abantu asolve at the same time. Umuntu angahambi kwi facility ekhala minyembezi. Imagine nawe kusisi wakho lo noma kuyingane yakho noma kubhuti wakho. Because vele ama relatives wo sonke la hamba ama facilities. Obhuti bethu osisi bethu omabethu. So I'd like to thank this opportunity. Thanks for giving us a eye opener, a very important because sabafuna abantu bo. Early missed, late missed, kanti asithu days. Ashuthi umdangisa nje kule clinic ngiyabonga. Yabona so nje ngicela ukubonga kakhulu uzosisiza kakhulu nathi ukuthi siphinde abantu sibahloniphe sibagqugquzele ukuthi beze ama clinic nani kwakuthi sicela give up ekuthina njoba sisho nje eshilo baba ukuthi izamba nelodwa lawabolisa wonke it's not this bonke abantu all nurses are the same abafani njoba nilala nani anifani we know this but ke sizwile kuhlalile enhliziyweni we'll do our best to change how we treat our community. Thank you.
Ngicela ukubingelela nami mhlawumbe sengingathatha nje noma ngawu 2 minutes nyana bengithi ngiyacknowledge umphathi wethu e-district bengithi mhlawumbe uzosimela but ke esikuzwile la mangakhumula nje ijazi leli neshirt ngaphansi kunemvimbe emkhulu kakhulu la ngaphansi so kodwa ke ngicela ukuphakamisa nje leli thuba sibonga kakhulu kwinhlangano ka Ritshidze kanye namanye ama DSP akhona la ama district supporting partners sizwile singabaphathi bama clinic by the way uMr Vilakazi lo umphathi wase eSongonzima clinic eSkopo kayincama so sizwile kakhulu angizo respond to each and every story esisitholile la but siyabonga kakhulu ukuthi as uRitshidze uyazi availa ukuthi uzosilekelela ekuthenini sithole labantu because as uMgungundlovu district across silahlekelwe abantu mhlambe aba more than 3000 aba on ARVs abekho njengobusho ukuthi bakhona khona la and niyazi avail ukuthi sisebenzisana because I district embarke on a project ka bring back u25% kulama patients asilahlekele a week kusho ukuthi a week kulama patients over 3000 kufanele ukuthi sithole at least 25% ngosuku ngeviki for the next 6 weeks so njengoba nilana ke nani imphakathi siyan invite asibuyeleni singezi ukuzonifuna emakhaya ngoba kuzosithatha mhlawumbe lokho i-energy enkulu kakhulu mhlawumbe kokugcina uMadlala la ukhulumile kakhulu ngakho ngifuna ukukhuluma kakhulu ngalento okhuluma ngayo eka OHSC kanye no Ideal Clinic Office of the Health Standards in terms of ama complaints bakwethu umphakathi wethu ngicabanga ukuthi awuyethembi kahle lento yama suggestion boxes but ngijabule kakhulu mangabe kukhona usiso reference ngosiso Samki uPRO wase Idindele Hospital noku responda ekuresolveni icomplaint yakhe so into kanjalo even kuma facilities siyahlala every week sivule lama boxes lawo siwabheke siwa-analyze siwafake na ku monitoring system ku Ideal kubonakala even ku province ukuthi eSongonzima clinic or whichever clinic ku complain ubani wathini so ngiyacela ukuthi asiqhubekeni siwasebenzise lama suggestion boxes because I status sama complaints njengamanje ngifike ngo August eSongonzima clinic but ama complaints awangeni kodwa abantu namba bakhona baya complain sekuze kwafika la uyabo la kade kufuna siqale khona silungise masinyane kungakafiki kuleli zinga akwenzekanga I complaint inama steps okuyilungisa so mina nje I've had one formal complaint to resolve in a space of how many months from August to September October November manje but I've only resolved one formal complaint niyabona so iminyango ihlala ivuliwe kuyakubaphatha akudinga ukuthi uzuyobhala ungeza nje uzongqongoza kumphathi eminyango icho womphathi omtholampilo khona izithombe ezinamathiseliwe ezinezithombe zethu nami uzongifica nje kune email address yami kunane cell phone number yami awudingi ne smartphone ungangifona ufonela umphathi noma ngabe ingasikhatsini ukuthi attende kulawo ma challenges but anyway it's an eye opener nathi sobuyela back ku drawing board siyolungisa kuma facilities zethu siyabonga kakhulu thank you.
Ngibingelele sisihlalo no Ritshidze organization no DSP partners bethu bonke ikakhulukazi nezithandwa zethu umphakathi ngiyanibingelela nonke ay sabekhulumile ama colleagues ami kodwa into nje engifisa ukuyi-highlighter ubhlungu esebuzwile mina as a nurse njengoba esho umfowethu uyabona a dedicatedness engawushuza lo msebenzi ngiwuthanda wobuhlengikazi angiwushuzanga nje ngoba ku whatever kodwa ngawushuza ngoba ngiwuthanda kwangempela so kimina njengoba besha bafowethu ibhlungu into yokuthi kanti lemtholampilo kufanele ngabe imiphakathi yethu ithola impilo khona kodwa itholani ukuhlukumezeka uyabona ngibhlungu ngalendlela ngangokuthi ithi inhliziyo yami njoba ngihleli lapha hayi kuningi ngempela okusafanele ukuthi kwenziwe ukulungisa lesi simo futhi I'm really committing nathi as a sub district ngoba ngirepresenta I sub district yoMngeni ngusibongile ngubani igama ebhlungwini bonke sengikhumbula amazwi asho umphathi wethu uqala nje lonyaka wathi kahle kahle ingoba imiphakathi yethu mhlambe ayazi kahle indlela zokucomplaina njengoba esho umfowethu kahle kahle ithi into entsha ye complaints ukuthi ngisho iclinic okucomplainwa ngalo kakhulu kufanele ukuthi lidisplay kwaziwe umfowethu nje wasempophomeni ade ekhuluma manje makuwukuthi impophomeni la kule sub district yethu okucomplainwa ngayo kakhulu kufanele ukuthi yaziwe nje publicly niyayibona leyo nto bese singena phakathi ke manje kwi facility niyabona zithandwa zami ade nibeke izitori zenu ngibhlungu kakhulu ngaphakathi enhlizweni ithi into ke manje makuwukuthi maningi ama complaint arezwa ngonesi ungubani kufanele ukuthi ngishi ikhanda lakhe lapha mawungena eclinical display welapha yana asikakakwenzi njengomnyango asikakafinyeleli lapha kodwa ngiyayibuka into yokuthi engathi sokuyi agency kufanele sikwenze nomphakathi une right yokucomplain ngithi kahle kahle phela kuyilungelo lenu ukuthi nizothola impilo hayi ukuthi nizothola ukuhlukumezeka ngiyaxolisa nje on behalf of I department ithandwa zami asingabaleki angithi nanka ama structures asivulela iminyango sonke njengoba debesho o colleagues ukuthi at least sinethuba le dialogue ezinjena zokuthi sazi sonke ukuthi kwenzakalani ngoba mina I'm going for 30 years kwi service yami kodwa ngihlezi ngiba challenge nalabe ngikhona ukuthi mangabe ukhona nje in my career engake ngamphatha kabi akamela angikaze ngimbone leyo nto iyayingiphe lokho okuthula kokuthi sawushuza lo msebenzi siwuthanda ngeke sikubalekele ukuthi akhona kama rotten potatoes kwi department kodwa is about time ngosizo naloba phathi bethu even up to a district ukuthi nje ingathi sokuyi agency lena okufanele ngempela ukuthi ngempela ukuze imiphakathi yethu isizakale ngiyabonga ngizonikeza nje ngoba besibheka umphathi wethu omeli district mhlawumbe ukuthi asho nje okubili okuthathu siyazi ukuthi isikhathi asisekho kuningi bengujotile nami iziningi ngabe izinto bengifisa ukuthi mhlawumbe in responding back kodwa ngenxa yesikhathi nango hand over to umphathi wethu omeli district kule ngaphakathi kwalenhlanganiso ngiyabonga.
Sanibonani. Ngicela ukuqala ngokuxolisa nje ukuthi ngihluleke ukubamba isikhathi ngenxa yenkingana ezibe khona eoffice nabaphathi bengekho kodwa ke ngoba umphathi wethu uyakunderstand ukubaleka kwale forum so bekufanele kugcineni sigcine sifikile kuyakuthiwa abantu uma ufuna ukuba ruler uqala ngokuba divide kuqala so that uzoqala ukuba control nami bangisusile ngala bangiletha ngala ngoba bebenzela ukuthi basidivide kahle kuqala khona bezokwazi ukusicontrol baphumelelile ke ngoba bezogcina kukhuluma umuntu oyedwa kodwa ke kuthiwa ufuna uqala uba divide bese ukwazi ukuba rola kahle bantu bakithi sizwile engiphuma nako nje ku2 staff attitude kakhulu engicabanga ukuthi zonke ezinye inkinga esinazo kakhulu zenziwa into yelokhuzana staff attitude nabantu kakhulukazi kuma keep hops siyawezwa ama complaints akhona kakhulu kubantu abama keep hops kodwa okunye engithanda ukusho ukuthi cishe ngathi colleagues nathi sisendleleni yokufunda okunye kusifice already sesikuyona iprofession okunye kusifice sesibadala so abanye bethu bafunda kancane kulokhuzana kunabanye njoba kade shilo uMrs Ngubane indaba yokucomplain kubalekile ukucomplaina kodwa icomplain yakho iyashesha ukulungiseka mo complain endaweni la okufanele ucomplaine khona ngoba manje isuka ithathe idry kakhulu ukuthi ixazululeke nanokuthi okunye sik-encourage njengomnyango ukuthi uma ngabe une complain ngami being uSister Mtungwa ayivele iuSister Mtungwa ukuthi uSister Mtungwa wenza ukuthi ingafiki isithi ama-nurse enza ukuthi because mase sifuna uku-intervene which nurse do you intervene in ngoba ama-nurse wonke ama-nurse siyayibona leyo nto kodwa-ke ku-Ritshidze thank you very much siyabonga ukuthi nisinikeze i-platform ngizwile ne-suggestion ekhona ye-meeting nama-structures akhona. I will take that up with our district director so that i-meeting isizokwazi ukuthi sihlale sibe ne-way forward. Ngiyacabanga ukuthi sizoyithola isamari as a district so that ke sizoqala uku-implementa ama-activities. Engikujabulelile-ke ileyo ukuthi kanti nizophinda nisisize futhi kule project esinayo ya 20% bring back to care ukuthi kanti sifuna abantu nje esiyitshela ukuthi balahlekile kanti abalahlekile bala bahanjiswe ilokhuzana yizathu. Ngize ngafunda neteme elisha-ke ngifike ngingalazi la ekuthiwa u-silent transfer bengingazi-ke khona into efana naleyo senguzwile impela u-silent transfer ngayi-understanda futhi ukuthi yini le yenza ukuthi umuntu kade simlapha sivele simbone singasamboni esehambile ka-facility A waka-facility B bese thina siyitshela ukuthi umuntu udifothile kanti cha utransferile nje silently. Ngiyabonga kakhulu.
Manithathe lithuba ndibonge kumuntu wonke ola ngaphakathi. Sicela uxolo ukuthi sithathe isikhathi eside. It is because inkinga bezininzi and yonke inkinga yomuntu ola is important like the other. So khange sifuna unqamula umuntu phakathi. But also with district two things. We have uMzamo is a provincial manager uhlala la eMgungundlovu. We've got Ritshidze in a district organizer nama community monitors including lama organizations nama branches out. So uMzamo and Ritshidze will reach to the district director so that sibone ukuthi how do we share this report and sikhulume ukuthi how do we address these issues. But also kukho usisi lo behleli lapha yana na lupha eback uya kwi clinics ezi2 to take treatment eyohlukene. Bencela kunye nabanye bencela ukuthi before siphume apha nosisi lo unganewanga treatment please ngasike xa siphuma la sikhulumisane naye about that clinic. What is the name of that clinic? East Broom ne? East Broom Clinic. Usisi akayitholanga treatment. She's pregnant. She's living with HIV. We fought for the prevention of mother to child transmission therapy. We fought for access to treatment. It can't be true that a place will be called a center of excellence, yet they continue to deny people treatment. So on that note, lastly, facility managers, we are here to work with you. We are here to work with you. But also, in order for facility managers and facilities to understand what it is important each facility to organize community dialogues around your catchment area. Ufake loudspeaker, umemeza umphakathi, inhlanganiso ye department ye clinic, so that the clinic can be able to tell umphakathi nge services abanazo and all other things esikhulume ngazo. But also nabaphathi be-clinic bakhone uhlala phansi bamamele izikhalo zabahlali. In that way it will help both of us, because from where we are standing, Tina, we know ukuthi these clinics are ours and we want to defend them and protect them. But if the situation is like this, nathi sizamela ekudeni kwi-clinic, so we need to build that relationship. Siyavala ngoku bese ndibulele. And I am unable to sing because abantu bayatya. Kancane sekusele kancane, kancane sezophumelela. kancane sekusele kancane kancane sizophumelela hayi sekusele kancane eLimpopo sekusele kancane eNatali sizophumelela Eastern Cape sekusele kancane Western Cape sizophumelela Siyabonga maqabane uThixo anisikelele sonke sihambe kahle sifike emakhaya. The meeting is adjourned. Thank you.